Namaste and good morning. Welcome to day 2 of Save the Young Heart conference. Through the several sessions on day 1, we have been given to understand that heart disease is very much preventable. Mild to moderate stages can also be reversed by several means. Without negating or excluding one treatment modality over the other, an integrated approach is what is recommended for holistic healthcare. It means improving heart health by combining medical treatment with lifestyle changes such as healthy eating, regular exercise, stress reduction, and good habits. Our first speaker this morning who will address us on this topic is Dr. Susheel Sharma, an interventional cardiologist with over 40 years of experience across India, the UK, and US. He currently serves as Program Director at Ramakrishna Mission Sevashrama and SVASA, Bangalore. Over to Dr. Sharma, please.
Thank you and namaskar. At the outset, please allow me to express my humble gratitude to all the great masters that came in my life through science and spirituality, that taught me, that made me who I am today, and that's what I'm sharing with you. And also at the same time, let me share with you, there's nothing that I'm presenting to you is my own. It's all that I've learned through their blessings that fell in my lap. I put it together, practiced in my life, and I'm presenting to you. What I'm presenting to you is what I learned and practiced on myself and put all these things together to create this program that I'm going to talk to you about today. First of all, let me set the stage right, because a lot of people wonder, what is this man of interventional cardiology doing in the field of integrated medicine? So let me share my journey from intervention to integration. So I trained in India and I trained in England and in the US. I'm an interventional cardiologist by training, and I practiced interventional cardiology for 25 years in the United States, in University of Maryland, Baltimore, Washington Medical Center, where I practiced and taught. Day and night, my job was to take care of heart attack patients. 7 days a week, sometimes, I spent in the cath lab, looking at these coronary arteries from inside. So several revelations came to me after doing these stents over and over and over and over again. So the first thing I found out is that's great that we put in stents when patient is having a heart attack, and it saves lives. There's no doubt about it. Also, in very complex disease with a damaged heart, if you do bypass surgery, you save lives. But in a large subset of patients, we are really band-aiding. We are really not finding the solution. We are just treating the symptoms of these patients. The second thing I realized is that once you go inside the arteries, you'll be amazed how different we look outside, but inside we're all the same. All the blockages that I looked at from inside, either through angioscopy or through ultrasound or through angiography, it's all a mixture of atheroma, the glue, the cholesterol, the calcium deposits, the necrotic core, and the blockage. And we all look same inside. After doing this over and over, it started occurring to me that there has to be something over and beyond that I need to explore. And that started my journey into integration. Initially in the US, I attended several conferences, Mind-Body Medicine of Herbert Benson at Harvard. I went there twice. Plantation Project, Physician Committee of Responsible Medicine, Whole Food Plant-Based Diet, spent time and learning from Esselstyn, from Dean Ornish, from all these stalwarts. And I found out that the answer to this problem lies in integration and not in more intervention. So that was the first impetus for me to switch gears. And the second was, I'm sharing this with you. I have a very strong family history of heart disease. My father passed away with a heart attack. My mother passed away with a heart attack. My brother passed away with a heart attack. And in 2017, my best friend passed away with a heart attack. So that is where I started looking more and more into it, and the urge grew stronger and stronger. And then I started working towards this program. In 2022, I closed my practice in the US and came to India. I needed to learn more in integration. I spent time in Haridwar, Rishikesh, Uttarakhand, and then I spent about a year in Bangalore at SVyasa with Guruji Swami, Dr. Nagendra and Nagaratna Didi. And that is where actually I started putting this program together at SVyasa, and then it morphed into the integrated web-based program that I'm here to share with you today. So first thing I found out is that technology is really advanced. So that center-based approach, the old center-based approach of cardiac rehabilitation is going to be a thing of the past. Everything that you can impart to a patient, you can do that online through technology these days. So you can have an integrated approach, the science and methodology you can impart on an app, and you can also do live yoga, meditation, and pranayama on an app, and that is how I started working in this program and put this together. So before I go further, a lot of skeptics in the audience question me and ask me, oh, hold on, what is this reversal? So let me set it straight. Some people have this erroneous notion that reversal means my 100% blockage is going to be 0% tomorrow, and that is not reversal. There is a scientifically accepted definition of reversal that I'm sharing with you. It's basically a decrease in plaque burden from 90% to 70% to 60%. It's a change in the plaque morphology from a necrotic plaque with a thin capsule that has a tendency to rupture, converting into a non-necrotic plaque with a thick fibrous cap that does not rupture and prevent heart attack. It also means resolution of the symptoms of heart disease, and it also means reversal means the restoration of the blood flow. So this is the structural reversal and functional reversal that I'm talking about. So please don't misinterpret and don't think that I have any magic that will convert a 100% blockage to a 0% blockage. So our integrated approach is Lifestyle Plus, and I'll share with you why did I switch to Lifestyle Plus from Lifestyle alone. Now, lifestyle is the cornerstone of all prevention programs, but lifestyle alone does not cut it. And I'll share with you further as I go along, there's some genetic abnormalities so profound that it's very difficult to reverse this just with lifestyle. So we need the help of guideline-directed medication. And we need to look at each individual's risk factors in a personalized way, individually, and define a program for him, what his prevention program is. So that's why our program actually is a Lifestyle Plus. Now, as in any other illness, so it's true also in coronary artery disease. There is an amalgam of three, actually there's three legs that a disease stands on. LEG is a very nice acronym you can remember. L for lifestyle, E for environment, and G for genetics. So most illnesses are actually a combination of these. The coronary artery disease is 80% lifestyle, 10% environment, and 10% genetic. Now, the role of environment is increasing as more and more pollution is happening, but this is a broad thing. So lifestyle alone is not going to cut it. In those that have genetic predisposition of a cholesterol of 800, an LDL of 300, or triglycerides of 3,000, lifestyle alone is not going to cut it. Okay, now we talk about cardiac risk factors. Now this gets a little confusing. We had a beautiful demonstration of cardiac risk factors last night from Intra-Heart study. Now when we say, so there are two things you need to understand in medicine. When we say idiopathic, etiology, you go to a doctor and you ask, sir, why do I have this autoimmune disease? Well, there's an etiology of this, that's idiopathic. What in English means is there is a cause and I do not know it. That's the English translation of etiology being idiopathic. So same way in coronary artery disease, let me tell you, we do not know why the arteries block. We know what factors coalesce and lead to somebody to have a blockage, but we do not know why they block. Because when you look at these risk factors that I'm going to share with you, some may have all 100% blockage, and up to the age of 110 may have no blockage in the heart, and some may have no risk factors from these, zero risk factors, and may have a heart attack at the age of 24. So we do not know everything. But whatever we know, please take home two messages. 90% of heart attacks can be detected before they happen, and 90% can be prevented before they happen. So what are the risk factors? There's some that we cannot change, but we need to know. Indian ethnicity, South Asian ethnicity predisposes us to heart disease. As the age advances, the risk advances. Male gender has a higher predisposition to blockages than female gender. And family history, as I told you in my family history. So I knew that I will develop blockages and I have to have a strategy to counteract that. If you had an MI before, a heart attack before, you are at a risk of heart attack. So if somebody asks you, what is the most important, single most important risk factor for heart attack, is a previous heart attack. He has the highest predisposition to get that. There are clearly lifestyle that I'm discussed with you, and I put that in an acronym, and that is also, by the way, my program, DASH program. D for diet, A for activity, S stands for stress, sleep, social, and spiritual, and H is your habits, alcohol and smoking, and then to that add also addictions, and then pollution and contamination. So that completes the lifestyle part of the risk factors. Then there are some health factors. There is truncal obesity, and I alluded to that yesterday during the panel discussion. High blood pressure is a very high risk factor, diabetes, and cholesterol. And then there are new emerging risk factors, the pollution, the air, the soil, and the water. And all these come together and cause blockage in the arteries, which we call as atherosclerosis. Athero means glue, sclerosis means hardening. So if the inside of the artery becomes glued and hardened and narrows a blockage, that's how you develop a blockage. And if that hardened artery ruptures, the glue gets extruded out, forms a blood clot, closes the artery, and you get a heart attack. Okay, so now that we know what causes it, now this is the study I alluded to yesterday, and this was a beautiful study. And based on this study, my conviction comes that the 90% heart attacks can be prevented. So if these 9 factors you optimize in your life, you can reduce the chance of getting heart attack by 90%. And this is a very large randomized study done in 50 countries, spread over 5 continents, with over 50,000 patients. And 10,000 patients actually were Indian in this study. And this is a study that first found out that psychosocial stress is a very big factor. And that explains why yoga, meditation, and pranayama is the cornerstone of our program. So is coronary disease reversible? Well, the answer is yes. And this is Dr. Caldwell Wasselstein, a great human being, most humble person I met, and very accomplished, Yale graduate, director of Cleveland Clinic, surgeon who switched to integration. We have one sitting here, and we have one here. And he was the one who did the first study on this. So let me share with you. There is a blocked artery to the left of mine and probably also to the left of you on the big screen, which is narrowing down. It's big, fat, straight segment coming down, and then it narrows down in the middle where I've labeled distal LAD. There's a blockage there. So there are some cardiologists sitting here. So can I ask somebody, how did this distal LAD get treated and now it looks like absolutely normal coronary artery? Dr. Saha? Ballooning or stent, yes. Actually, those of you who have had a stent or do the stent like I did, yes, this is called a stent-like result. This is what a stent does, okay? But this was not stent. This was diet alone, only diet. And it's not one patient. This, by the way, is the coronary artery of a doctor who was the head of the surgery breast program at Cleveland Clinic. He had 80% blockage in this artery. The interventionist said, it's too far down in the LAD, I can't put a stent there. The bypass surgeon said, it's way downstream, I cannot bypass it. They both put their hands up, and he said, come on, I'm 40 years old, I'm having chest pain every day, I'm a chief of breast surgery, I have to work. And then he stumbles upon Esselstyn. Esselstyn treats him, and he was disease-free and symptom-free, diet alone. So what did he do? His total cholesterol was also not very high, 156, LDL 89, but at the end of 1999, which is almost 2.5 years, it came down to 88 and LDL of 38. So let me here talk about one very important thing. Most of what the cardiologists use these days to calculate your risk is called, a scientific term for that is pooled cohort equations. And they began in a small town called Framingham in the United States. And the beauty of Framingham was just about everybody was educated, very homogeneous society. And there were about 30, 40,000 residents at that time. Now, obviously, Framingham is 150,000, maybe 200,000. Everybody participated in the study. And they set out to say, okay, let's do this longitudinal epidemiologic study. Let's follow them over a period of time and see what are the factors that lead to the blockage. And that is, gleaning from that, is how these pooled cohort equations came, and now we have several pooled cohort equations. So this one single thing they found out in this was that anybody in the city of Framingham whose total cholesterol was below 150 never had a heart attack. So if there's one take-home message you want to take today, if your cholesterol is below 150, that is the greatest immunity you can give yourself from heart attack. Yes, again, with lifestyle. This is Dean Ornish, whose program, we take a lot of things from his program also, and he reversed the arteries with a diet and lifestyle, which included yoga and meditation. And then we had intensive lipid lowering, some medications these days that are available that can bring the cholesterol way down. If you bring your LDL down below 70, your risk of heart attack goes down. If you bring it down below 55, you start reversing. And this is the reversal evidence on ultrasound. Okay. So I already told you why the current model fails. Because current model is an at-risk population-based model. Our program is based on an at-risk individual model. And that is the only program that we need in India for the simple reason because most of these 20, 30, 40, 50 years old, you cannot detect disease in them based on those old-fashioned at-risk population models of pooled cohort equations or a stress test or an echocardiogram. Nothing is going to show up on that. Majority of the heart attacks that occur in 40 years old are in blockages that are less than 50%, and they don't show up on a stress test or an echocardiogram. You know the most disturbing statistics, 50% heart attacks in India occur in people less than 50 years of age, and of those less than 50 years of age that have heart attack, there's also 50% mortality from the heart attack. Okay, I already discussed this with you, 90% can be predicted, 90% can be prevented. So what I did is, I said, let me put together all published trials in reputed journals where, preferably randomized, where reversal was shown by one or the other modality, either clinically, stress test, angiography, or IVUS, or OCT, and put them all together and see what was common to them. I came out with these 17 or 18 published trials, and there hasn't been one since. This I collated in 2023. And I took practices from each one of them and I said, let me incorporate these and see if we can put it together into a program to deliver prevention, rehabilitation, and reversal. Now, these 4 things you need to know. These are typically Indian. Apolipoprotein A I discussed yesterday, ApoB, ApoA ratio, atherogenic dyslipidemia, and metabolic syndrome. In the West, most of the blockage is driven by LDL and total cholesterol. In the East, it is driven by these 4 syndromes. So most of those 20, 25-year-olds that I see in Haridwar, they have one or more of these. So this thing that people say, he was a normal person and he had a heart attack. No normal person gets a heart attack. Please remember that. It's an abnormal situation that comes due to abnormalities. We've never tested these. What you don't know does not exist for you, and therefore you're normal. So this is what we do in our program, these 15 parameters that we do, and these are the levels that we arrive at. If your desire is prevention, you can normalize 3 or 4 of them to moderate levels. If your desire is rehabilitation, normalize 7 to 8 or 10. And if your desire is reversal, you optimize all 15. If you bring all 15 of these to the levels that I mentioned there, it's highly unlikely that you'll have a heart attack, and it's highly likely that you'll reverse, 90% chance. So this is the 10 pillars of DASH that I put together: diet, activity, stress, sleep, social, spiritual. And the way we deliver the program is this way. So the bedrock of the program is yoga, meditation, pranayama, and there are all these practices that we have chosen, these 13 parameters. Again, everything has been chosen based on science. For example, peer support is based on Dionish's study, health literacy based on Dionish's study, nutrition based on Esselstein's study, stress management based on Dionish's study, and aggressive risk factor modification and guideline-directed medical therapy based on all these statin PCSK9 studies that I had on the right of the arrow. And this is how we do it. When you enter the program, we have your baseline parameters. Okay, then we do integrated lifestyle change. We do medication change, which includes guideline-directed medical therapy, identify your risk factors, give you a list of what applies to you and how that is modifying. You have a way of monitoring your progress, monthly progress, and those of you who desire reversal, then we can repeat angiography, CT angiography at the end of a year and demonstrate the reversal. Now, there was some discussion about diet a lot yesterday, so I just want to bring that. How do I go back on this? This button? Can you go back 4 slides, please? 2 more. 2 more, please. 1 more. 1 more. Okay. There was a lot of discussion on diet yesterday. This actually included this morning. This was not part of my presentation. So let me tell you what my philosophy on diet is. I really wanted this to get out. Number 1 is the best diet is what your grandfather, great-grandfather, great-great-great-great-great-grandfather used. Because it takes 10,000 years for your genetics and epigenetics to accommodate what you're putting through your mouth and your stomach to the best of your body's need. And therefore, your traditional, local, seasonal, available diet is the best diet. You make 10 changes in that. Change your grain from processed to whole grain, because that's what your ancestors did. And millet is an unprocessed grain. Or you go to green leafy vegetables and legumes and fruits. That forms the baseline. You minimize salt, oil, and sugar, and you minimize animal, dairy, and processed. That's all you need to do. You don't need to eat anything exotic from anywhere, from any other planet. For example, quinoa from somewhere and chia seeds from somewhere. This is the only change you need to make. And in a program, we do it in a graduated manner, 1 change a day for 14 days. So why are there barriers to acceptance? There are many reasons. There's skepticism in mainstream cardiology, most likely due to knowledge deficit. When we trained in cardiology, there was no such thing as lifestyle medicine, prevention, reversal, integration. None of these existed. Secondly, obviously, in most nations, including India and USA, there is no reimbursement for lifestyle transformation. It is not a remunerative. It's not a financially attractive enterprise. So it's only for those that have, like me, that have given up on working and have free time to devote, are practicing it. And there's also limited awareness amongst general practitioners and also among general public. So it behooves upon us to get this message to as many people as possible, like we're getting out today. So again, my cardinal lesson is shift from a disease management model that we have today, take medicine for blood pressure, medicine for cholesterol, medicine for diabetes, to a disease reversal. Blood pressure, diabetes, cholesterol, heart disease, obesity, they're all reversible, and we should strive for that. We have to empower patients not just with the knowledge, but the inspiration and also tools, the know-how, how to do it, a manual that they can practice, hold their hand and guide them through. And to do that, we have to build inclusive teams of integrated-minded people, which includes a dietitian, a counselor, a yoga instructor, meditation, pranayama, etc. The future direction, obviously, we'll be using AI a lot, which is going to be helping us, combining new technology, new sciences of proteomics that's coming out. And at some stage, I think it's going to need a large randomized trial to really bring it to the mainstream public, to really get the conversion of the skeptics to the idea. So lifestyle transformation needs mind transformation. To me, the best tool for mind transformation is yoga, meditation, pranayama, and that's why that forms the bedrock of our program. So modify lifestyle, identify your risk factors, take guideline-directed medical therapy. Lifestyle Plus is a solution for reversal of heart disease, blood pressure, diabetes, cholesterol, and obesity. And thank you for listening. Thank you. Any questions? Sorry? Yes, very good question. You mean lipoprotein little a or yes, okay, yes. So lipoprotein little a is a genetic abnormality that creates certain particles in your blood, just like the cholesterol or the LDL. It's 5 to 10 times more atherogenic than LDL. It's thrombogenic and it also causes inflammation. And 20% Indians have it. And if it goes above the level of 100, 200, it becomes a causative factor in the heart disease. Yes, at the present moment, there are no definite drugs available for that. There's a very large trial going on. The reason why lipoprotein little a is in buzz these days, you know how this is, how Western medicine is driven through incentives. Now, for the last 10 years, we've known this lipoprotein little a for 25 years, but it's come in vogue now because we know that we have found a drug, and the drug is undergoing trials. There's pelacarsen, which is the Amgen drug. It's going to come out in, I think, March 2026. It's going to come out. And that lowers lipoprotein little a by about 90%. There is inclisiran available right now that lowers by 25%. Niacin lowers by 25 to 30%, but then there's a risk of stroke, so I don't recommend that. So in the absence of this, anybody that has lipoprotein little a that's elevated, number one is weight. The drug is around the corner. Number two, at least whatever is the risk factor that you have in your life, through all the risk factors that I mentioned, mitigate that to the best of your ability by lifestyle plus integrated heart center approach of lifestyle transformation, guideline-directed medical therapy, and risk factor modification. At least take that risk away, and then you're only left with the risk of the lipoprotein little a, and we'll have an answer next year. Yes, sir.
Yeah, let me compliment you for a wonderful presentation first. I have 2 points to make. When you said lowering of cholesterol, what is the role of statins in lowering cholesterol? Because as I understand, the small dense lipoprotein that matters, okay, for coronary artery disease, and the large fluffy is cardiovascularly neutral. So whether the statins lower the small dense LDL or they have no effect on the small dense LDL. That is one point. Okay. Second point is prevention requires to be done at the primary healthcare level. It cannot be done at the tertiary hospital level. Unfortunately, in our country, primary healthcare or preventive medicine is not incentivized. Okay? So that requires at a policy level, incentivize. A clinician brings 300 of blood sugar, for example, to 180, okay, lot of applause. But a pre-diabetic is converted to a lot of effort by a primary health physician to a normal person. Nobody recognizes this, okay, tremendous effort. So your comment on this. Thank you.
So I think there are four, if I understand, there are four things that you said. So the first is cholesterol. Every time I do this presentation, the most prevalent disease in India is cholesterol denialism. This is actually a disease in India. Nothing has been tested as much as cholesterol. 400,000 patients have been enrolled in randomized trials, and it's been shown again and again. We may not know how cholesterol works. Is it the lipid-lowering effect or a pleiotropic effect? We don't know that. But we do know that when you bring cholesterol down, the risk of heart attack goes down, and there have been trials and trials and trials and trials that have shown that. So to me, this is an accepted fact that if you have high cholesterol and you want to reverse, you need to bring your, as I showed in the slide, your total cholesterol below 150, your LDL below 50, your triglycerides below 100, ApoB-ApoA ratio below 0.5, hsCRP below 1. That is what has been borne out by the randomized study. However you do is fine. For example, Esselstyn did that with diet. If with diet alone you bring your cholesterol below 150, you mitigate risk of heart attack. So begin with lifestyle. But some people are unfortunate. Their liver enzymes are upregulated because of some genetic abnormality. They cannot bring it down with lifestyle. I did lifestyle. I brought it down about 30%. But there was a barrier. I wanted to bring my LDL below 50. And that requires medication. So that's one question. The second question is, yes, at a policy level and public level, that has to be done. But I have limited time. I have limited time on this earth, and I have limited time on my hand. So I decided that I will not go at any primary, secondary, tertiary prevention model that exists today. I will take the program at the home of the patient on a device, on a WhatsApp. And when I initially did this program, it was very encouraging. I enrolled 5 of my doctor friends in the USA and 10 of my patients in India. My village people in India knew exactly how to navigate WhatsApp better than my trained cardiologists and friends in the US. So every Indian has a smartphone, every Indian has WhatsApp. It's very easy to deliver this. So I want this integrated program to go to the home of the patient and not wait for the government to do any policies and all that. That's for the policymakers. At my individual level, that's what I want to do. Take it to the patients right now in their home and make them understand in their language and give them the tool that works based upon the existing knowledge that exists today by putting together the current available randomized trials as they presented and prevent the heart attack 90% and detect the heart attack in 90% of those before it happens.
Two quick questions regarding again lipoprotein A. So did you come across any lifestyle ways in reducing this LPA?
No,
that is one thing.
I can give an anecdote. There's a patient who joined my program from New Delhi, and he followed all the lifestyle thing. He had 80% LED blockage and asymptomatic, and I said, you don't need a stent, we'll work with you. And we did. He did everything possible, and then about 8 months into the program, he had chest pain. I said, that's very unusual. Why don't you go and have an angiogram? And he had an angiogram, and his LED was now 95% stenosed. And since he was having unstable angina, I advised him to have a stent. And then, this was early on in the program, and then when I tested that, I found out his lipoprotein little a was highly elevated. Now, he can afford, so he took inclisiran. I said, take inclisiran. It lasts 6 months, so at least 30% LP little a is lowered. Next, you'll have pilocarsen. So this is anecdotal experience that lifestyle may not work in lipoprotein little a elevation, but it's still needed.
One more question is regarding these lifestyles, what I have seen is the sustainability. Many patients that I see, they are initially very much enthusiastic in doing whatever we say, but after 3 months, 6 months, they come back to the same old levels of their LDL and weight gain, obesities, blood pressure levels. So how do you see this program to have a sustained levels for their benefits?
So that's $1 million question, okay? So I'll come in a roundabout way to this. 5 years, 10 years ago, when I used to do these programs, 1,000 people will join online and only 5 will join the program. And I struggle and struggle and struggle. And then I said, okay, let me find out. I call it Duryodhan's dilemma. Janami me dharma na cha me pravritti, janami me adharma na cha me nivritti. Everybody knows what's right thing to do, but they cannot motivate themselves to do the right thing. And everybody knows what the wrong thing to do, what is wrong, and they cannot dissuade their mind from doing the wrong thing. And that is intrinsic in all of us. I think all motivation is intrinsic. Nobody from outside can motivate you, but you have to ignite that intrinsic motivation to help you to propel this motivation forward to change your lifestyle. And that needs mind transformation. And mind transformation can only happen, at least I can tell you myself, experienced on myself, only through yoga, meditation, and pranayama, 3 of the best mind transformation technique. There is no scientific basis, no scientific study in the West that modifies the mind. The West is very good at studying the outer nature. The East spent all its time learning the inner nature. So the science of inner nature is ours, from the Patanjali, from the Gita, from the Puranas, from the Upanishads. So meditation, pranayama, and yoga. That's the answer.
Thank you, sir. Can we have you back on stage, please? I request Dr. A.N.V. Prasad, Head of Department of Radiology, to hand over a token of our appreciation to Dr. Sharma ji. Thank you. Environmental toxins such as air pollution, heavy metals, pesticides, and chemicals in food and water can silently affect cardiovascular health over time. These toxins can trigger inflammation, damage blood vessels, raise blood pressure, and increase the risk of heart disease, even in young and otherwise healthy individuals. Addressing us on this topic is Dr. Praveen Saxena, Dr. Saxena is a physician and integrative medicine expert with over 30 years of experience in treating chronic illnesses through science based natural therapies. Trained as a radiologist, he now focuses on environmental and functional medicine, including detox therapies and holistic approaches to cellular health. Dr. Saxena, please.
Thanks a lot at the outset. Such a ambience. I'm a slightly a musical guy. I'll start with a simple this one. Again, a Hindi song. हर घड़ी बदल रही है रूप जिंदगी साइंस भी बदल रही है छाव है कहीं कहीं है धूप जिंदगी what an atmosphere what we have I doubt in Hyderabad we don't have this kind of things at all uh, coming to this Anand Agarwal my great friend somewhere I'm really happy that I came to this, started with the yoga in the morning after a long, long time. And I'll just try to do a few things. I'm not, there is no financial interest. I'm not come here to sell anything. I'll be focusing on what is the trend now. Why that yesterday, that question somebody raised, why young hearts, why there is sudden heart attacks which is happening all over. Let us try to look into some of the things. So we all talk about elephant in the room, but we don't want to acknowledge that. I worked on something called metal toxicology, and I started working on autism. After that, I started looking into metal toxicology, and we felt this is a public health issue. Most of the vascular toxic metals are in and around you. We know about Delhi air pollution. This place is absolutely ambient, no pollution here. But the people who are living in the metros as well as the 2 and 3 tier cities, they are facing this ambient air pollution. Air pollution, when we talk about for the students, I'll tell you what exactly is this air pollution. You have got 2.5 and you have got PM10. If with 2.5, it's ultra thin particulate matter. Whatever goes into your lung is gone from lung. There is a membrane. From there, they get into the vasculature. So all the particulate matter of 2.5 PM, which has got lead, mercury, whatever sorts of thing, what you can say, it directly gets into the vascular system. We have been trying to scratch our heads, what is the initiation of this atherosclerosis? After all, we believe cholesterol is an innocent culprit. When you scratch this surface, you have got this pathway, you have got a lining, and if there is a scratch over that, then cholesterol comes over that and tries to make a scab. So we'll just go across some of the things. We need to, there are some students, you can always look into what this guy is talking. There's a thing called transitional metals, heavy metals. And everything is related to role of calcium, magnesium, good minerals and bad minerals. Again, it is also a Mahabharata happening with this particular thing because all the water, what we get in the cities, are having a high levels of mercury, lead, and all that. Arsenic is so predominant. So we'll just look into this particular thing. There is a, we had done few cases which has got coronary calcifications, and with this coronary calcification, we are able to estimate as a radiologist. I should tell, okay, you are in a more chances to get a heart attack. And what exactly is this? Because this is a recent phenomenon. Probably we don't had that, but we started doing CT angiographies way back because with the Suresh we did with 64 slides also that one. But that way not that this one. Now that the fourth generation thing has come, we can pick up quite easily. But after something last 4 or 5 years, where everyone is coming up with some calcification score, and he's asking what can be done for that. Let us see. We had identified heavy metal in the urine of the patients who are having toxicity. And Dr. Sharma, India is a very toxic place where water, air, you cannot have any bharosa about water, what you are having it. So this is what exactly is coronary calcification. You see the calcification in LED. Your doctor, Deepak, will tell, no, we'll go for an angiography. Fine. Why exactly this atherosclerotic plaque and what exactly is it? It is an activated NF kappa B calcification. And you see the kind of things, how it activation of this transcription factor and how it goes up. And you have so many, don't want to confuse you with all that particular thing, but this is the rationale why things are happening. So there is a stains, people have done some work on that. Finally, it was found that it was a macrophage activation, monocytes come into picture, you have got osteoblast cell-like cells, and there forms a calcification. So now that the patient comes with this calcification of, say, 400 score in the LAD, and now what to be done? So what we started looking at, Dr. Saab, is we picked up blood lead levels of these patients. Once we picked up the blood lead levels, what we have seen, there is no uniformity in the lead level status of people. In US, 0 to 5 is considered normal. Here, up to 150, Thyrocare gives up to 150 is normal. I don't think we can really survive with that. We cannot follow 50 years old standards. So this is vascular calcification is a good clinical marker, Anand, and this suggests there is a chronic inflammation. See, there is a tali ek haath se nahi bajti hai. Something has to be there. Probably there has to be some periodontal infection, or again, we are talking about more in terms, whenever we see calcification, we used to see there is any calcification is there. There are studies which were done. Biofilm also was extracted in that. Okay, this cultivation of microorganisms were detected, and what I have seen is people who who had a recent MI and all that, I have seen their oral health is not good. I'm still trying to work with a few dental doctors. Periodontitis is a cause of something. So this polymicrobial infected biofilm is that calcification, and how do you work it out? I was talking to our group of doctors. Garlic is one of the best kind of thing, and there is something called aged garlic. This is called cocholic acid extract, and it helps like anything. We are a thing called EDTA we use in lead toxicity a lot, proteolytic enzymes, and something like ozone, and my practice is most based on these particular things. So again, a word of thing, Ayurveda says, even my grandmother used to say, ki this is pet theek rakho, something is okay. Subhash, I think you can agree with that. You are asking me what is to be done for this. This is something like leaky gut. We need to work on that. We had to work on some of the areas where high amino acids, proteins, which are not digested properly, they enter into your bloodstream and causes a problem. So this is already proved. There is an intestinal origin of bacteria in the CAD, and we are so. What is the Anandji follow-up? How people come to us? Oh, can you remove that calcification? It's not that easy removing calcification. If I am able to control this calcification from not growing further, because there are studies where we had baseline calcium score is a predictor, and if it is more than 15% happens every year. The standard rule is you do every 5 years or 6 years, but in a country like India where MI just comes like that, you have to look into this particular thing. If your calcium score goes above, then you are likely chances. And the thing is, we always, I have been discussing with a lot of people, we know obviously we have got air pollution, we have got water pollution. So what next? The thing is, when we know that we are living in a dangerous situation, we need to see that our bodies, they don't get overloaded. You need to, I take it very seriously if someone comes with a fatty liver, high CRP, high homocysteine, these are the kind of things. So, again, calcium score, again, diabetics, non-diabetics, diabetics, I don't know why diabetics have been always on the receiving end. And there is, I don't want to go further and further, but there are multiple references. I can always give you all these references. Aged garlic, first class. The grandma's kitchen, if you go to grandma's kitchen, because nowadays kitchens are different. It is not grandma's kitchen. You have got mixie, you have got pressure cooker, you have got microwave. That is not grandma's kitchen. Grandma's kitchen was something, oh, used to do that mechanical grinding. So garlic, such a useful kind of stuff, this can make a big difference. So here comes the advantage of the integrative medicine. Was Dr. Susheel was telling so much about that, but I'm really happy because this cannot be worked out with single thing. It has to be an effort of Anandji also, effort of yoga, Nagaratnaji, Sushilji. Everything has to come into thing because one thing cannot control this one. So coming back to, yeah, this is one thing I just wanted to have a, it is not a consensus or whatever is it. India में क्या चल रहा है अभी? Anybody can tell what is being run in India? Fog. If I go to a medical college with a lot of students and all that, they say it is fog. So the thing is, we have been systematically poisoned. We need to work on how we can always work it out. Yes, and other things are also, there is still no answers. We are not here trying to blame someone that this is wrong. But when we look at the narrative and we look at the chronology, vaccines causing heart disease may be a reason. I'm not trying to tell that it is the only reason. The reasons are, number one, AstraZeneca, which was rejected in USA, it was started in Europe, but it was withdrawn immediately. Why the hell that particular thing is still we were at the receiving ends? When something is banned at some other countries, I have got that, maybe I call it as a vengeance, because I worked on mercury toxicity in vaccines. The thing was, we won the battle halfway through itself, because mercury was removed from the American as well as European countries, and it was not removed as a preservative in third world countries. The same thing happened with this COVID, AstraZeneca. Labels change, tuck. So now there is a kind of work which was, I will give you all the rationale, what was presented in this. Spike protein probably may cause by activation of macrophage and causing cardiac there is a thing we have been always talking about why, how this happens and all that. You can always deep dive into this particular stuff. And you can always go back to the studies also. There are about 600,000, so much deaths which have occurred, which were reported from vaccine in the other parts of the world. Why हम कुछ दूध के धुले हुए हैं क्या अग्रवाल साहब? इधर नहीं होता है क्या? We are not ready to accept that. As a doctor, I was not ready to accept my son can be autistic. I am still trying to see that, अरे cholesterol थोड़ा बहुत चलेगा. नहीं, we need to work it out because we don't have that kind of thing. We don't do a proper pathological examination. We cannot go for all that things. Radiologically, we can prove this. Subacute myocarditis is one thing which happens after vaccine. And if during that time your inflammation, you are inflamed. All of us came in the morning, everyone was fresh, nobody looked inflamed. In that inflamed state, you start doing some more exercise. Yesterday, Philip's guy was showing us what is that high heart rate variability and all that. Everyone got that answer because we did in the evening 5 o'clock. Everyone said, he was suggesting everyone not to now exert yourself. Okay, what happens is that it doesn't, is written here. Your CRP levels, your D-dimer levels, your things are subacute if you have got myocarditis. With that, you are in the chances of getting into arrhythmia is more. So this is how the topography is, how people have worked on all the stuffs. Can just go through it. Maybe I think there was some slides, was not this one. So this is, it has not been proven or it's not being disproven also. There is a still question mark. So we need to be careful about that. Our people are not good at, no one knew what was adverse, VERS, adverse effects of vaccine, how to fill up that. People are not aware about that. I'm talking about doctors, that is a different thing. So I stumbled upon something called chelation therapy, where I thought, okay, whatever be the case, you have got diabetes, you have got fatty liver, you have got something like hypertension and all that. Then we started doing, okay, these lead levels are high, mercury is high. We started reducing that levels and we started getting answers. I think this is, again, okay. So, we started working on three major things: lead, mercury, cadmium, and these are the things which lead has got a big role in Indian continent, and most of the lead comes from your additives in your food. I'm coming from a place called Hyderabad, which is known for a biryani. The red color which is added is nothing but the lead. So a lot of things in medicine, people have used this particular thing. Even the water pipes has got lead inside. Now, whatever brass fixtures, what you are getting, even that has got 7% lead. So you need to be careful about this lead and heavy metals. Where these heavy metals go into the body, they get into the bloodstream. From there, that enters into the soft tissues, they go into the bone, and it's a fixed deposit. You're not able to, it's a fixed deposit. It gets into your kind of thing. And whenever your bone starts, you starts getting bone loss at the age of 50, women as well as men, that time this lead is coming out. We have been systematically poisoned, Agarwal sahab. Did you, 30 years back, we used to have a leaded petrol, not a de-leaded petrol. Right? Unleaded petrol, now it is written there. So we had been, all these people who are that around 50, 60 age group, they have been poisoned with these heavy metals. There was one of my friend was there, he was able to do this particular stuff. And this is the artery which looks like, you have a control on one side as well as the case here. So it gets into the bone. We can pick up from the X-ray. I'm sure AVS is going to work on from bone also. There is a thing called X-ray diffraction. From that, there was study in AIMS also. They did it initially, and we found most of us were having that particular stuff. So again, there were a lot of follow-up studies and all that. Lead toxicity and hypertension have been on the kind of thing. There are multiple studies. Only thing is the cutoff marker is a issue. Lead levels more than 10 10. And people come to us at 75, 80 and all that. That's the kind of thing people come at. And this is known to cause this particular stuff. Not just lead. There were again studies. This is I presented in Association of Occupational Health. So I thought it is a pertinent thing here. Polish workers case. You have got this particular thing. Of the best particular thing what we have picked up was this was the mechanism arsenic toxicity. I'll give you a small. It's not a story, but it is a fact. In Taiwan, what happened was people from a particular village, they started developing blackfoot. It was called Blackfoot disease of Taiwan. So they started looking into why these people suddenly got the foot which is black. Blackfoot disease of Taiwan, 1977, this phenomena started. And they found out that they are taking water from a specific well which has got high levels of arsenic. And later, there was a prospective study also went on for that. After 20 years of follow-up, they found there was a thickening of the coronary arteries also. That was the thing with this stupid arsenic. And I am sure we did some studies in Hyderabad at random kind of things. Arsenic is higher. People having diabetic neuropathy, having that sensory neuropathy, you reduce arsenic and he or she becomes within 8 to 10 weeks, she becomes normal. So this was the thing. I can always quoting all these things. Mercury is a big one. People who had post myocardial infarct, their nails and hairs were checked for levels of mercury, and it was found to be higher. So trying to make a point here कि ए भाई जरा देख के चलो आगे भी नहीं पीछे भी दाएं भी नहीं बाएं भी खाने में क्या है हवा में क्या है everything has to be looked into. This is my thing. I don't want to get into this tag trial, but tag trial was one study which was done by Dr. Lamas, and he was a cardiologist, and he gave a clean sheet on people who are diabetic. The people who diabetic, Dr. Anand, it was like that, people having microvascular disease. You are doing a very good job, yeah? You are doing LAD, you are putting a LAMA, everything is fine. But what if, what Dr. Saab has shown, that distal artery, what if that microcirculation has got the chunk of the disease? I think there we can always pitch in. And it is again a complement, it's not a this particular thing. Diabetic patients is one thing. And I think I can go on and on, but I believe as a society, we have to start looking at what is coming up next, but with the incessant urbanization, whatever we had seen, something is not good at health. Dr. Sharma, people do come at the age of 30 also was. And there are some things which every one of us, I was really happy, all of you students are not supposed to carry cell phone. It's one of the good things what you have been, by default, something you are doing a great work. And I keep talking about electromagnetic radiation also. That is also one of the big elephant in the room. And Anand, I can open for any questions. Yeah.
Praveen, Praveen, I need to thank you here. This was fantastic talk. Couple of comments rather, any questions. So as you say, हवा में pollution, पानी में pollution, खाने में pollution, जाएं तो जहाँ कहाँ. For translation, there is pollution everywhere. So where do we go?
One thing I can always tell you, you start working on 4 things, Anand. See that you sweat daily, number 1. The second one is try to keep your poops very, you should be always, your bowel movements ideally should be 2 times per day. Bowel movements. आपको वो खाने की ज़रूरत नहीं है, कायमचूर खाने की ज़रूरत नहीं है. And the third, with that, you are trying to have a good this one. See that your urine is always colorless. You try to take that much water, which makes your urine not dark. And the fourth one is do that pranayama, because all these 4 channels, if you are working properly, hepatobiliary excretion, renal system, don't overload these 2 systems. Because whatever people come to us with already the fatty liver, he doesn't sweat. Start doing sweating, things will get better. Yes, for a people who are documented to have high lead levels, we work with calcium EDT and all that. Yeah.
Fantastic, Praveen. Another few comments about statin. So there is I think if we have a time today, Dr. Sharma, we must have a small debate. We'll see, depending on the
somewhere.
So, Dr. Praveen Saxena is totally anti-statin. Am I right? No, because we need to get the truth. Because I am also like a cat on the wall.
No, what I have seen is people having vascular calcification if they are put on statins, their calcification is increasing.
No, because see what Dr. Sharma was saying and what all I ran at a conference recently, they are talking about drastic reduction in LDL level.
No,
For
you need to maintain your coenzyme Q10, Anand. If you are not able to maintain your coenzyme...
but we need to see what I sincerely feel, Dr. Deepak. I hope that this doesn't go out of the hall of Premamrutham hall. The statin is a $1 trillion industry. All the trials regarding statin and heart disease, I feel they are not. I'm just telling out
The
of
trials
my
are fudged. Trials are
because
fudged.
I feel drastic reduction of LDL. I'm not talking as a cardiac surgeon, as a skeptic and a layperson I'm talking. Because you need cholesterol in all brains and all the organs. You want to reduce cholesterol drastically. There is a evidence that statin causes diabetes, statins causes
Nephropathy.
dementia.
Nephropathy.
I know Deepak is nodding his head, it may not. But I think we need to have a multidisciplinary approach. Maybe it might call for a integrated approach towards statin care. We might plan one thing. Because
Anand, I can add one thing. If you're taking statin, you add coenzyme Q10 because at that HMJ
no, Praveen, this is not a forum. I'm just raising a question. Last comment, Dr. Sharma and Deepak. I open coronaries, you image coronaries. We are looking at macro circulation of myocardial revascularization. Till now, we do not know what is the microvasculature. Sir, you got 90% LED stenosis. I do beating heart. I open the LED, my whole blood comes onto my face. So I feel there is a lot to be done, Praveen. I think this conference,
if there are some medical students, I'll tell you how to pick up microcirculation.
We don't have...
You have to just see the nail bed. If it is pale, that's fine. And people having microcirculation, distal leg hair, there will be loss.
No, we're not talking about peripheral microcirculation. I'm talking about myocardial microcirculation.
Exactly.
Dr. Sharma, what is your comment on that? Do you have any studies to show beyond the macro coronary arteries? I know how subendocardial ischemia works because once I pledge a heart for valve replacement and all, how heart gets done, it comes out later on. So I just want your comment about coronary microcirculation. With this, I think we'll close this session.
Yeah.
So this is a new emerging concept of CMD, the coronary microvascular dysfunction. In fact, there was a very nice review on that in 2024 from European Society of Cardiology. For the longest time, we have been focused on epicardial coronary artery, the big arteries. You either plumb them by putting in a stent or you bypass them, detour them by doing a bypass surgery. And there are two studies I want to talk about. I know we have an international cardiologist in this room. I want you to go and Google a study called Orbita trial. And what they did in Orbita trial is they selected 100 people, 50 went in, they went in from the artery, went in, injected the dye, saw the blockage, but did nothing. In the others, they went into the artery, saw the blockage, and put a stent. And they followed them. 6 weeks later, they found out what was the level of symptoms, exercise tolerance, perfusion score in these patients. To their utter surprise, they found out that there was no difference in patient that got stent versus the patient that got no stent. And they had 80% blockage. And that is the first time they found out that the major benefit of a stent actually is placebo. And a minor benefit is some circulatory benefit. And the reason for that is because Dr. Saha will concur to that. 30% of a patient after a stent come back and say, I still have chest pain. And we didn't understand. We know it now. The microvascular disease was not changed. So what really affects microvascular disease is lifestyle. Whole food plant-based diet, activity, sweating, yoga, meditation, pranayama, optimizing the S4, sleep, social, stress, spiritual, and getting your habits straight, alcohol, smoking, addiction, taking care of the pollution. All these things, this lifestyle works beautifully, improves microvascular circulation, and more studies are going to come out. In the end, we're going to find out, at the end of the day, this Christmas, if there's anything you have to ask for God, ask for a healthy endothelium. And the best medicine for healthy endothelium is lifestyle And the best way to motivate you to practice lifestyle, I keep coming again, is please do yoga, meditation, pranayama. Thank you.
Yeah, Dr. Sharma, the take home from this and with meeting you is only one particular thing. I need to go back and start doing yoga and meditation process because I was not into that particular stuff. वो चंचल मन है एक बार बैठने से होता नहीं है कुछ भी. But I will definitely, the way you showed, your person has showed that particular big take home. Let us try to, yeah, Deepak. Easy question. Trial
No,
ball.
not for you questions, just for clarifying the Dr. Anand's query regarding statins. Most of the thing already Dr. Sharma has answered in his presentations. Statins, definitely patient is having atherosclerosis. The best drug right now we have is statins. It's not an ideal drug. No
How
doubt.
do you compare with niacin?
Yeah, it's not an ideal drug. Let me complete. It's not an ideal drug because it has its flip points also. It causes some dementia, maybe slight increase in diabetes, but it definitely prevents heart attacks. That is for sure.
It is
You ask me,
making people lose their memory here.
yeah, if you are asked in the next 6 months, you want a heart attack or slight reduction in your dementia, what will you do? I don't want a heart attack. That is the question. That is
First
sure.
start.
So definitely it prevents heart attacks.
I think, Deepak, we'll extend the conference by 15, 20 minutes because we are finishing. You guys prepare.
Perfect.
You against statin. Sir, we need to have a debate today. Let us finish it off today. You and 2:1, Praveen.
Yes, sir.
Huh?
Yes, sir. Yes.
You have the data.
So as Dr. Saha said, there has been nice review on that. Absolutely no association between statin and dementia. Okay, I tell you, just like you guys sitting here, I was blessed with, God had been kind to me, very good memory. I was a good student. And all my friends always complimented me on how I remembered things, even page number in the book and all that. But I started taking statins 2017 when my best friend dropped dead. And since 2017, I've seen a distinct improvement in my memory. My memory today at the age of 69 is much better than what it was at age 17. I remember text that I read, pages that I read, studies that I read, much better now than I studied about 30 years ago. So if statin had anything bad to do me, I think statin has probably improved my memory. I don't know if it's yoga, meditation, pranayama, or whatever it is, at least statin has not made a dent.
Yeah.
I think we'll close the session now. Praveen, you get ready. I'll see where to adjust.
Perfect.
Okay, 20 minutes debate. You are going to talk on against. Deepak, you are ready to talk? Sir, you're going to talk for or against? Or you work. So it's 2:1, boss.
No, you are to come along my
Okay,
side.
I'll come. I don't have any scientific evidence
Go
to talk
batsman,
on. Okay, fine.
bowler, seconds.
Okay, thank you, sir. Thank you.
Thank you.
Yes, sir. Good morning. Sir, here. I have a small question regarding your
I'm
topic.
So sorry. Tell me.
How do long-term, low-level exposure to common environment toxics like air pollutants, heavy metals, or plasticizers, which contribute to silent cardiovascular damage, and what early screening tools or biomarkers can help detect this risk before clinical symptoms appear?
Yeah, I think it's slightly a complex question, but again, it's basically what we now already proved. Air pollution causes of, these people, WHO also has told air pollution causing this. We tried giving some things, how this is causing that. There is a vasculature, is an inner layer, is a slimy layer. And if it gets some kind of thing, that's what is the hypothesis. Yes, you spoke about something on plasticizers. Plasticizers are here to do a greatest damage to us. Plasticizers are not just causing endocrine disrupting organs, it is totally making a havoc. Cancers are a big thing. Heart disease, yes, there are some things, but not much on that. So what are the screening methodologies we do for picking up if you have got low lead toxicity and all that? What you can do is, we worked in with a place where now we are looking at just a blood test. Blood test for heavy metals, there is a screening actually, where you get lead levels, you get mercury, you get other levels also. So you can always have that particular baseline. The second, if you are having, suppose, more toxicity, what you are going to get, because this is a chronic toxicity, everything will not be there in the blood. So you may get in the nails and hair samples. We try to work it out. But we see a overall trend, the higher the lead levels, the higher the homocysteine, and the lower your vitamin D. Now, can you tell me, only that students and all that, other people, any individual who is about 25, 30, doesn't know about vitamin D? Most of my patients, they start taking vitamin D supplements. Agarwal sahab, aap bhi lete ho. Right, Subhash? So, why this is so thing? We are living in a tropical country, in a country like India, where we have a good sunlight. What is the reason for dipping vitamin D levels? If your vitamin D is low, think about lead or other things. That is because lead is some metal which goes along with calcium and magnesium. To form a good vitamin D also, you need a cholesterol, you need to have a uptake, there are some things. For that, calcium and magnesium helps. In case you have heavy metal toxicity like lead and mercury, that thing is disrupted. So that is a proposed mechanisms why there is a thing. Another one is plasticizers was a good thing. There is a one more dangerous element with what we are facing these days is something like glyphosate toxicity. Whatever your agriculture, what you are having, crops and all that, that is more pesticides as well as particular glyphosate, which is a product. And that has resulted in totally changing your microbiome in the intestines. Your intestinal flora is totally gone. Yeah.
Thank you.
It is a review. This is a review. Thank you. I'll review later. Thanks a lot. Thank you.
Thank you. Thank you, Dr. Saxena. I request Dr. Anna Rao Kulkarni to please hand over a token of our gratitude to Dr. Saxena. Thank you. Before we proceed, we have an announcement. The Department of ENT, Head and Neck Surgery at Sri Madhusudan Sai Institute of Medical Sciences and Research is conducting a 3-day workshop and CME on rhinoplasty from 21st to 23rd July. This will include live surgeries. All those interested may register through the QR code that is being displayed, and registration is free. It is also available, it will be available on the website of our hospital. Artificial intelligence is playing a growing role in healthcare, from early detection and risk prediction to treatment planning and patient monitoring. AI can help doctors analyze complex data quickly and accurately, leading to faster diagnosis and more personalized care. It is reshaping how we understand and manage diseases, including cardiovascular disease, making heart care smarter, more efficient, and more proactive. We have this morning a team of 3 experts who will elucidate more on the topic of AI and heart health. Mr. Vamshi, Managing Director and CEO of Deep Facts, who's leading innovation in early cardiac screening and predictive healthcare. Mr. Vamshi, can we have you on stage, please? Dr. Suresh, a globally recognized medical oncologist and AI research pioneer with over 20 years of clinical and academic leadership. And we also have Mr. Adarsh, India Business Lead for Philips Coronary Artery Disease Venture, working to turn cardiac emergencies into preventable care moments through data-driven solutions. Over to the 3 gentlemen.
Namaste. This is Vamshi. I'm not a doctor. This is a disclaimer from my side. There are so many doctors here, so that I want to be more cautious that I don't speak wrong here, right? So I'm an engineer, and let me tell the story how I start Deep Fats. In 2019, one of my best friends passed away with MI. We are good friends. We used to go to gym and all. We used to do very good workout and everything. All of a sudden, he was passed out. And 1 month before, his body is telling, okay, I'm having some issues. Go and meet doctor. But we thought that these are all assumptions from our side, saying that, okay, due to workout, we got some muscle pain or something like that, and we went to orthopedic instead of a general physician. And so when we went there, he has taken an X-ray, and he has given some medication and physiotherapy and everything. One day, all of a sudden, he has passed away. This is due to a wrong direction we have taken. Second, there is no a proper sensing technology available, readily available to sense that there is some vital changes happening inside the body. So that's where we started coming up with deep fats, where we came up with a device, a small device that can capture all the key vitals and provides a remote patient monitoring services to the doctors as well as to the patients wherever they go. And our motive or our mission is to take a non-invasive devices and see that we reduce the gap between a doctor and a patient at any point of time. And I know that most of the doctors think that AI is getting replaced, but no. Wearable devices, AI is enhancing their medical practice and reduces the stress between them. This is what we call AI is going to enable more of the doctors to have a better care to the patients, always, and also a better treatment plans can be provided to the patients. This is what altogether AI and the wearable devices does. So in deep fats, we call a ProRhythm. It's a non-invasive, a small 40 grams device that places on the chest and it's a wireless device. And our uniqueness is we came up with a non-invasive, cuffless BP monitoring included in the device, where it captures your vitals and provides a real-time monitoring platform for the doctors. And also we provide a scorecard which alerts the doctors and the nurses in advance to control or to take a better care, see that the patient is not getting into any critical conditions. And also we started developing a ring which can provide a non-invasive BP as well as a non-invasive blood glucose monitoring. We totally depend on non-invasive models. And we are at the stage of 80% accuracy on the non-invasive blood glucose, where I don't say we achieve 99% or 100% in that, because there's no pain for the user on the prick side, so that it can just give the trends and so that it can follow a better trends which can set the doctor whether the patient is doing in a good way or whether the diet need to be changed or he needs to have a better treatment plans can be designed. This is what the whole our deep fats does. And what we believe is the wearable devices need to be used, but cautiously need to be used, because what I believe, if we start using the devices, we shouldn't get addicted to the devices. The devices are now controlling us, but we should be reversed so that we shouldn't get controlled by the devices. The wearable devices are good, but it should be limited and see that we are see that it's only for the data purpose, not for the enhancing or coming to the conclusion purpose. The doctors are the right people to take that conclusions and giving the plans, but not because everything is in cloud now, on the web now, so that if we see a blood pressure high, automatically our fingers go towards the Google and say that, okay, my hypertension is getting high, what I need to do. Some medications will come. If you take that medications, it's going to be risk to the patient or risk to the user. So we have to be controlled in such a way that we shouldn't take steps based on the devices or based on the results what it has given, but this is more like a screening. So it prevents from the event, so that we have to be controlled. So as Save the Young Hearts, we are all young. Hopefully I'm also young. And we see that we should use devices properly, and we see how best we can have our hearts clean and healthy. That's what all I want to speak around. And thanks, Anandji, for me to give this opportunity to speak around. Thanks.
Thank you. So first of all, thanks, Anandji. Asmat Gurbiyo Namah. Thank you. So let's start what a doctor is speaking about AI here, right? So can I have my slides, please? Okay, right? Fine. So whenever we speak about artificial intelligence, there is nothing artificial, there is no intelligent about it. So it's absolutely misnomer. It's all about mathematics. If you advance one step from the mathematics, you land up in statistics. And if you use the statistics in a much more efficient way, you may call it as an advanced artificial intelligence. And if you teach the machine how to do it by itself, so if you teach me, I'm learning. So you call it a machine learning. And if it gets repeated, it will start thinking. That's called Gen AI. And if you can do it in a large quantity, it is called quantum AI. So that's what is the simplest way that I look at the AI. Otherwise, it looks like a big devil, which is going to scare me. Okay, but it's simple, it's nothing but evolved mathematics. Just like how we evolved from chimps into intelligent people, maths evolved into AI. That's it. At the simplest form, I keep it, right? So as doctors, we always look into the research and then critically analyze, like I have been hearing about the statins, pro and con. So each paper can be looked into two different things. What we call the bhashyas of some poems and other things, right? So it's the interpretation of the things. In research, you look at the p-value. In AI, you call how confident you are. There is a lift, confidence, support, recall are equivalents of sample size, p-value, specificity, sensitivity of a research paper. There is no big deal. It all depends upon different language. It's the old wine, put it in new bottle sort of thing. AI also have to be interpreted based upon the data, the confidence it is going to give. If you are in doubt, ask the question. If the answer is poor, ignore the AI's advice. So it is not something which is right. So that's what, as a doctor, I look into the data whenever AI suggests me something that this is great. I call, are you confident? It says no. So what is your recall? Poor, keep it aside. What is the data? Good quality, bad quality. So these are the things that drives me to think whether this is a good one or a bad one, right? So it all depends upon the data sets, how the sampling bias is there, and what the calibration is done in doing those things, right? So one of the common things that people speak is HRV, right? So this is the biggest thing that always bothers me. Heart rate variability is classically driven from the ECGs. There is a derivation that is done from the ECG to the pulse plethysmogram, which lost 20% there. And it is calibrated between a particular range. And if it goes out of range, it goes even completely out of range. See, it's like Chinese whisper, right? It starts somewhere and then ends somewhere else. So it's like during the translation of a poem from one language to other language, what is lost is a poetry, right? You lose the beauty there. So if you just keep on just extrapolating, starting from one point to the end, thinking that everything is fine, that's not right. So in AI, you need to be very careful to what extent they are stretching their interpretations. So HRV, I'm not trying to say it's bad. I'm telling If you stop at a point of time, that's okay. If you stretch beyond a point, it breaks, right? So I just give one quick thing, how we did, right? So one common problem that we have is people fall when they are elderly. So how to detect it? So it's rule-based approach is what people can think. If you have XYZ axis, if it falls down in 6 seconds, probably you are lying down. If it happens in a second, you fell down. So it's simple. So gyroscopes can detect it. So does it mean that every fall have to be addressed? No. Every vertebrate corrects its posture in 20 seconds. So those that doesn't get corrected in 20 seconds is something significant. So is it again worth calling a doctor for that? Probably not, because if it is slippery or dark, you don't want to stand up. So at that time, HRV comes into the picture. If it settles, that means you are consciously not standing up. If it is not, then call the doctor. So this is called rule-based development. So if you just keep everything in a condensed form in a ring or a patch, that what we did, is called fall detection, and I call only whatever is a significant fall to the doctor or a caregiver. So AI is all about what you teach to the machine rather than what machine is trying to teach you. So if you remember that, that's what the doctors or the youngsters who want to become AI engineers or doctors want to keep it. Understand the problem, define logical solution, apply it in a scale is what the AI is going to do in the healthcare. And in the heart, it is even more important because every day heart emits millions of signals, so as the brain. So neuro and cardio are so complex that unless you have a large data modeling to decode it, you may not be able to do it. And the third is oncology, which I practice, where the cells speak in a very different language in a more complex way. So that's how I see that the AI in heart, or for that matter in the healthcare, have to be heading in the future. Thank you very much. So we have a lot of success stories in the heart, like Apple Watches for the AF, heart failures, and cardiomyopathy detections. We ourselves are doing one very innovative thing for which we got a patent granted. That is, by looking at the mammograms, I can tell whether heart attack comes or not. Just because the calcium gets deposited in the breast arteries is very similar to one that gets into the coronaries. And calcium alone is not enough because it can get, any damage can heal through calcification. So we have applied a rule in which calcium applied as a part of the healing versus as a part of nature versus as a part of the post-inflammation can be distinguished using AI by doing the image analytics. And I need not do any extra test. The existing mammogram can tell if I superimpose the genetics on top of it. So it's all about applying the right logic in an existing system and try to get more information out of those things. So there are a few stories how we evolved about using the AI into the health, specifically heart and oncology, using images and genetics. I think I'm on time. Thank you very much, Anandji, for giving the opportunity. If you have any questions, probably I will take it after Adarsh's talk or together. Perfect. Thank you. Please, Adarsh.
Hello, great. Um, Fantastic to be here. I have a deep connect to this place. I know a lot of people here. I really have to thank all of you for coming here and letting me talk. Thanks to Dr. Anand for giving me a forum. And of course, I am very deeply thankful to the Swamiji. I've met him a couple of times. I really adore what he's doing here. So great to have you all here. I see a lot of young people. I see a lot of women. And the fact that this is Save the Young Heart makes me feel very pleased. So, ellarigu namaskara, pranam, thank you for letting me talk. So, can I have the next slide, please? So, what I would like to talk about, people have talked about, the reputed clinicians have talked about solutions to healthcare. People have talked about AI. I really want to talk from the consumer. Nanagu nimgu yen sambandha. What is my relation to you as a consumer, right? So I want you to understand data. because I want to understand data. One of the biggest impressions on my life has been a book by Dr. Vikram Mehta when I was young. And the book was interestingly titled, Where There Is No Doctor, right? And what I learned from that book is, you really have to understand yourself. If you don't sleep well, what will happen? Nidre madala yenagatte. If you don't eat well, sariya oota madidre yenagatte. If you exercise too much or if you exercise less, what happens? What are the symptoms you see? What makes you tick? Because now we are also a machine, so we need to understand. So if I look at the data in the, yeah, this is forward. Huh? So if you look at the data in the public domain, by which I mean newspapers, you will see data that starts from the number of people who die from heart attacks and from the number of people who are prone to having a heart incident, right? Now what gets lost in the middle? Yen kadadogatte andre, the fact that 350 million people in India, 350 million is not a small number, it's a big number. They're all set up like a pyramid. At the top you have people who die and at the bottom you have people who are at risk. And all of them are moving like a conveyor belt to the top, right? I mean, they may not all die, but they are sure to have some kind of an incident. Right? So I always think that we have a responsibility to ourselves, right? Which is, don't treat the doctor like fire brigade. Just because you're in an emergency, don't ask him to yank you back from that. Go to him early, go to her early. Give him some of your knowledge about yourself. I am telling you, you look up to them way more than you do today. And they should be looked up to. They're amazing people. But you really need to give them a chance to be better for you, right? And what is the unfortunate offset of all of this data that you see? It is the fact that your costs go up, your mortality, which is deaths, go up, your morbidity, which is suffering, goes up. So, tumbane kashta padtira life ali, and from a very young age, right? And of course, the cost and the quality of life really suffer, right? So that is of course public domain data. Philips has a very interesting service called the Heart Print, which we do on the smartphone, and I don't want to talk about that product here. But you know what we learned? That almost 30% of young people, 30% is not a small number, they have poorer health than 50 to 60 year olds. Remarkably counterintuitive. Nang first time arthane agla, hey, chikkavaru, how can they be worse health than older people? But it's a fact. We have seen this across companies, across communities, across any kind of heterogeneous cohort that you pull up. I have seen this, right? That's to me a frightening thing. Everybody talks about working too hard. But did you know that almost 4 out of 10 people in this room and probably outside, they're all working way harder than, their body is working way harder than it should. And that is something to be serious about, right? There is a lot of, if you look at the government, they talk about prevalence rates which are around 11 to 13%. We have found it to be way higher, almost double in the, than what the market says, right? So these are all statistics that are, if they are not scary, then I don't know what else it could be, because we are part of that statistic. Nam ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ. They are talking about us when they put these numbers. They are not talking about somebody else, right? So that, to me, that's the realization that we came to. So ನಾನೇನು ಹೇಳೋದಂದ್ರೆ, from our perspective, we should avoid emergencies. We should as much as possible go from emergencies to electives, from electives to medical management, then medical management to lifestyle changes, and eventually some amount of self-care, you know, so that we can help ourselves better. So I got a short quiz for you, okay? So let's see what the heart is capable of. Does anybody know what the efficiency of the heart muscle is? Any answer? 60%? You'll be interested to know that it's almost 70%, right? So do you know what the efficiency of your car engine is? It's hardly 30%. It should tell you how good your heart is, right? The fact that the heart is an electrical device, everybody knows. It is like a source and a consumer. Do you know how much energy, continuous energy is, as a light bulb the heart consumes? Almost 100 watts, right? Do you know how much a poor household in India consumes? 273 watts. Just imagine what the heart, how powerful the heart is, right? So these are very interesting statistics for me. The liters of blood pumped is a very general statistic. It's available everywhere. Whatever it pumps in a day, you can fill your underwater sump or your swimming pool. Just think about it for a second, right? It's a remarkable data point. Number of kilometers your heart could drive a truck in a lifetime. Pump madi, all the effort if you could put, you know what it can do? It can go twice around the earth. Twice. That's 160,000, right? The good doctor will always tell you that 40% of the heart is pretty much mitochondria, and that's because of extreme energy resources that it has. And probably the heart, when it beats around 3.5 billion times, right? And why do I tell this? You know the smartwatch that you have on your arm, 100 million beats of your heart could power this for your lifetime. That's how powerful the heart is. So I think all of us should realize some amount of care should go into this, right? So I'll spend very little time on this slide. Doctors have already spoken about all of this, but I only want to leave you with one question, one prashne. If your doctors tell you that lack of sleep, lack of exercise, poor mental health, all of these start affecting your heart, why is the reverse not true? The way your heart behaves, why should it not tell you what you're doing wrong? And this is a question I want all of you to think, because it is really true. I have a crack research team that goes into all of this and figures out wonderful correlations. We're able to start predicting just by looking at your heart behavior what you're doing wrong or what is going wrong with you to a large extent. But this is more than the technology. I want you to be aware that if you can listen to your body, then automatically you will be able to answer these questions. Am I okay? Another first gotagbidate. You will know whether you're okay or not. And if you're not okay, you'll go to a doctor and say, hey, fix me up, do something. Or you'll go to a wellness provider and say, let's do something together to improve my health. And I think this is what I really want to bring home the point. And the fact that there's not a whole lot of difference between subclinical and clinical, even clinical technology and research is going that way. But you are the first point of subclinical. Don't ever forget that. It's your heart that we are talking about, right? And all of you as young people, old people, you need to have that responsibility to say, I can monitor myself. Okay, this is, okay. So this is again something from our data that we brought out. So we have done millions of scans now, and from all of this, we figured out that the bottom 5% and the top 5% are more or less identical. They really suffer and these guys really prosper. And this is true across all ages, all genders, right? And somewhere in the middle is where most of us are. The 35% that you see is typically people either recovering or going down. And the 30 plus 25, 55% is where most of the working class is. And it's a remarkably astute observation that I had from one of my friends also, who's a sociologist. He said exactly this is what you see in the population. In society, this is exactly what you see. There are people who are really poor, who cannot afford anything. There are people who are really rich, and that demographic is exactly the same. Health has now become a social problem. And if anything else, this proves that, right? Health is a social problem. Society runs on good health, and if we don't contribute to it, then we are going to perpetuate this problem. But remember that whatever you do, how hard you work, how hard you overwork, or how much you overwork, is a evidence to you as to what to do and when to do. And if anything else, this slide proves it. Last, I need to talk a little bit about what I am interested in. I'm really interested in doctors campaign here, but we run something called the Green Art campaign, which is very similar. What we do is we get everybody to scan once on the smartphone, and we give you a population insight of the heart of the company or the organization, which we think is a fundamental way to understand yourself. ನೀವು ನಿಮ್ಮನ್ನು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕಾದ್ರೆ ಸುತ್ತಲೂ ಎಲ್ಲರೂ ಹೆಂಗಿದ್ದಾರೆ ನೋಡ್ಕೋಬೇಕು, ಆವಾಗಲೇ ಅರ್ಥ ಆಗೋದು. ವಿ ಕ್ಯಾನ್ ಓನ್ಲಿ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ವೆನ್ ವಿ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಅದರ್ಸ್, ರೈಟ್? ಸೊ ವಿ ಮೇಕ್ ದಿಸ್ ಪಾಸಿಬಲ್, and I am hoping that doctor will join our campaign as we go forward. But it's been a pleasure talking to all of you. And I hope the message is clear from my side. Please do take care of yourselves. You are important for India to go forward. Okay, thank you.
Thank you, gentlemen, for being here and sharing your thoughts with us. I request Dr. Sajid, Head of Emergency Department, to kindly thank them on all our behalf.
Just the last comment, So, Dr. Sharma, it has been a very holistic approach in terms of the basic of inter-art risk score through Save the Young Heart, that you are predicting mild, moderate, or severe. You have a battery of 10 tests, apolipoprotein and all the HRCRP and all those things, where you can give a 90% prediction. And you have said 90% of the heart attacks can be prevented, 90% of the heart attacks can be detected. And we have a wearable device from Vamshi, which can monitor and alert the nurses and doctors about heart which is overworking. And we have something from Philips, which actually gives a heart energy, and they don't even do it on the individual. I had a session with them in their own factory. They can go to community, they can actually, in our hall, they can predict what is the heart energy in this. So what they say is, because people working in the atmosphere, in the same environment, they have got similar stress level. And what my good friend Suresh spoke to me in the morning about predicting your coronary calcium by looking at the breast. So I think all our modalities don't work in silos. We have to, if at all we want to prevent such, as Sadhguru says, to establish Sanatan Dharma, he is bringing all the rivers of our Sanatan Dharma together. What is the end point? We become Sanatani. So in the same way, to save a young heart, the individual, and as Adarsh was saying, they are speaking about us live, as we are included in that cohort. So I think post this conference, all of us need to work together. Thank you.
It was beautiful listening to you three gentlemen. And AI, I call it augmented intelligence, by the way. So the beauty of AI is, I tell you, in the integrated field, in the lifestyle medicine, it has been said time and time again in all conferences in America, there will never be a randomized double-blind trial. And there are two reasons for that. One is logistic problem. There's so many variables in lifestyle, and controlling each factor and doing a trial will need millions of patients. Number two is there's no financial incentive in saying that if you exercise 5 days a week, heart risk goes down. Nobody benefits from that. So there's no remunerative incentive in this. So I think that AI is the only technology that is going to find the solution to lifestyle, which one works, which doesn't work, that deep learning, deep thinking, and the solution. So I'm really excited. I think that, just give an example, I've been struggling to form a lifestyle index, if you're doing that lifestyle right or not, based on the parameters that I test. And I've been working on it for a long time and could never come up with an index. So one day I thought, let me do one thing, dump and ask. So I picked up the whole thing, that 10 pages, I dumped that on ChatGPT, yes, the paid one, yeah. And I said, make me an index. Bang, it came out. And I tell you, what came out was 100 times better than I had myself designed over the last 10 years. So I'm very excited about it. I think it'll be great to work with you guys. And those Philips thing that we saw yesterday, I think we combine these three technologies. We already have the answer that we need and start the monitoring and do a lifestyle project. It'll be great. I think I'd love to work with you all. Thank you.
Very well said, Sharmaji. What I feel today is because of the skepticism about the AI, the doctors feel that the AI will replace doctors. It's absolutely untrue. Today's world, as Dr. Sharma says, doctors with AI knowledge will replace doctors without AI knowledge.
Vamshi, your thoughts, not thoughts basically, there is a thing called, you're talking about the ring. The parameters what you are giving is only 2, BP as well as?
Including BP.
Okay, everything includes HRV also?
So it's whatever the smartwatch gives, we give everything, plus BP and a non-invasive blood glucose.
Perfect, yeah. Suresh, between all of us, people post-graduation, they are not going for radiology. I'm being a radiologist because they are afraid AI is going to disrupt them. Yes, it is happening. People are not opting for
I'm
that.
endorsing, I'm just saying that is true, but you need to come out of that fear. Right? You can always keep on, you can become a teacher to the AI.
Yeah.
Any further questions we'll take later.
Thank you. I invite Dr. Sajid to come and felicitate these gentlemen, please. Dr. Suresh. Mr. Adarsh. And to Mr. Vamshi. Thank you, all of you. We now move into a unique session that explores acupressure, a traditional technique that uses targeted pressure points to support overall wellness, including heart health. Bringing an entrepreneur's perspective to this practice, we invite Mr. Mahesh Agarwal, who will share insights on how acupressure can complement modern approaches to preventive cardiac care. Mr. Mahesh Agarwal is a technology entrepreneur with over 25 years of experience across banking, insurance, and government sectors. As a founder of Aritians and Incessant Technologies, he brings deep expertise in AI solutions and actively supports the Save the Young Heart initiative to improve cardiac health outcomes. Mr. Mahesh, please.
Wow, from last 2 days I've been hearing all technical terms in the medical industry from all the medical experts. Of course, I will not be able to remember all the technical terms, but I can sense what they're talking about. Being an engineer, we can always sense. But not a doctor. I'm the other side of the table. I'm on the side of the table of being a patient, like a victim of all kinds of stress in the life. Somebody was telling me about the air pollution, the food pollution, the water pollution, but there are two more pollution. The pollution in our actions, the pollution in our behavior. That is also killing our health. So when I was talking to Dr. Anand, he gave me saying, talk about your entrepreneur journey. So I will cover two important topics. And of course, this has relations with the health, but I will not be able to talk in terms of evidences, scientific evidences, but I will be able to talk what I sense in my journey. So my entrepreneur life, and one of the ancient treatment that I learned in the last 10 years is acupressure. So I'm Mahesh Agarwal. I founded 3 companies in the IT world. You all heard about IT companies. They're making good money, a lot of money. We were very lucky that we earned so much of money working 8 hours, 9 hours, but keep hearing that IT people are working 18 hours. I don't believe that. They spend a lot of times over a tea, over a coffee, over a smoke, over alcohol. I'm also victim of the same. We all do that, but we cannot work more than 10 hours. Medically, if you can challenge me, I can. And we can only work more than 10 hours when we love something from the heart. If I talk about the army doctor yesterday talked about the people sitting in the Siachen, they can work because they love from the heart. Otherwise, we can't. And that is another problem we are all facing through. We don't love our work, and therefore we get into stress, right? Fear. When I was coming over the stage, I was having fear. What do I speak in front of the medical experts? If you ask me about all the evidences and data from my IT world, I can speak confidently. But in the medical world, I can't. All right, coming to the actions. Very sincerely, what I have seen in my life as an entrepreneur, as a founder, managing people, the most difficult part. We can manage machines, it's easy. Machines listens to you. Whatever you ask machine to do, they do it for you. The man doesn't do, the human doesn't do. You become the victim right from the moment you take birth, from your parents, from your siblings, from your friends, when you get married, from your spouse, then you become father, from your kids, everywhere. And now you get into the life of expectation. Everybody has got expectation from you. And sometimes you forget about your own self. So in the entrepreneur life, if I talk about my actions, and I remember one instance, but before I said, starting from the day one, getting customers, negotiation, competition with the big vendors like Accenture, TCS in the market, recruiting right talent from the market, working across the geographies. When you talk to a person in New Zealand versus in Australia versus in Asia versus in India, Europe, US, culturally they're very different. You have to remember whom you're talking to. And I remember Dr. Sai that you may not remember. In the second year of my entrepreneur journey, in the last company I came to you, I was having actually chest pain. And Dr. Anand referred to you and you did my 2D echo and you said, there is something in your heart muscles. I don't remember the technical term, but you said it seems to be very tight. And I was having pain. I was having back pain, chest pain, stiffness in the body, every possible thing that I can go through. And after a few journeys, struggle, we started getting a little success in our business. I started feeling a little happy, a little satisfaction in my heart that we were able to achieve. But Dr. Anand always meet me in the evening. You always travel. You get into all kinds of abuse of alcohol, smoking, lack of sleep, travel, no food. Go and do your test. And he referred me a doctor again. And I was afraid that Dr. Saha told me something 10 years ago. What will happen now? Has it increased? And he said, perfectly all right. And I was like, happy, of course. Then I found out why. So after this correction of my actions, particularly when I was managing my team, if I talk about myself 15 years ago, I used to react heavily. And I used to get high blood pressure, palpitation in my heart, stiffness in the body. Started managing the team, managing the expectations, managing the argument, converting an argument to a more structured argument, become calm, composed. But in the meantime, I said, there is something I need to do to my body because, Dr. Sir, as you said, always reach out to a doctor. It's not possible. If I'm on a travel, I'm in the US, you know how hard it is in the US to reach out to a doctor. Here, we can. But it's something what I can do for myself. I was having heavy back pain. And then I got referred by somebody to learn about acupressure. That came into my life. And I call that as a magic. I mean, yesterday I was talking to somebody. I was not able to walk properly 10 years ago. As per the medical report, the disc bulging between L4 or L5 or something like that, Dr. Chakradhar Reddy, he told me that it has already burst. As per your MRI report, you are supposed to be bedridden. But I'm walking, I'm running, I'm traveling. I don't know what happened inside my body as per the MRI report, but I'm fine. And acupressure has really worked for me in a big way. I'm not going to give any training, but I've got some acupressure pen. If anybody wanted to meet me after the session, please come to me. I demonstrated few yesterday night, but I will give you 3 important examples that I have experienced in my life. One thing is that my own back pain, the burst disc, it is not giving me a problem today. I don't know what is happening inside, but I'm not suffering anymore. Second, all my chest pain, stiffness, acidity, acid reflux, kind of all disappeared. It only come back when I get into stress again. But it immediately disappears when I know which acupressure points to actually press. And I call it as a magic. Third, my wife is suffering from rheumatoid arthritis. There is no cure about rheumatoid arthritis that I have learned so far. So there is no treatment. But whenever she gets this pain, there is an inflammation in the joints. And what I learned, if you can remove those fluid from those joints, the pain will get reduced. And started doing that practice. And in about 20 minutes to 30 minutes, I can see that she starts feeling good. She always tells me, 50% of the pain is gone, I can walk now. And that is where acupressure works for me. It's one of the ancient way of treating your body. This body is designed by the God. It has given a mechanism of self-healing, and acupressure works on the same concept. And this is where they talk about, and in the medical world, everybody already mentioned, the circulation of the blood. If it is perfect, all your organs get the right energy, and the organs are controlled by the nerve. So your nerve function has to be better, and that is where acupressure plays a very good role. Thank you.
Thank you, Dr. Mahesh. I request Dr. Raghupati to please hand over a token of our appreciation. We will have a break now. Coffee and refreshments will be served outside. We will resume by 11:30. Thank you. Sai Ram. The next segment will be refreshingly different from what we've heard so far. We have two remarkable men who will share their own life experiences and secrets of their good health and lifestyle. We have Dr. B. N. Narsamurthy ji, Chief Mentor of Sri Sathya Sai Lok Seva Gurukulam Group of Institutions, and Dr. A. R. Raghupati, Director, Liaison and Strategic Growth at Sri Madhusudan Sai Institute of Medical Sciences and Research. Both of them bring invaluable experience from the fields of value-based learning and medical education. They will share their thoughts and reflections on the journey and vision that guide this mission. It is noteworthy to mention that Dr. Raghupati was once a student under the tutelage of Dr. Narsamurthy ji. Over to both of them.
Om Sai Ram. Pranams at the lotus feet of our Divine Master, Dr. Madhusudan Sai. My respected teacher, guide, Murthyana, delegates, students, guests, Sai Ram to you all. Thank you, Dr. Agarwal, for giving me an opportunity to talk to you all. Thanks once again to you for not giving any topic. You asked me to give our experiences regarding process. When I was a medical student 55 years back, in our village, there was no diabetic patient, no hypertensive patients, no cancer patients. But now, if I go back and see my village people, in every house, I will see one or the other problems in their family. Why? Why this is happening? I just introspected myself and did my analysis, what are the reasons. For me, I think three are the most important reasons I am finding. Number one is food habits. Second one is the lifestyle. Third one is the relationship between in the family and the neighborhood. I'm not able to see the same love and affection which we were getting at 50 years back now when we go there. The situation was same. We were, to be frank with you, we are all rice eaters. Our forefathers used to eat rice only. But what is the difference? When we were young, I should thank government for that those days. When we were young, we did not have the luxury to have white rice. We had the luxury to eat unpolished rice. We did not have the privilege to eat sugar. Sugar was totally rationed one, and it was available only to the rich people, because those were thought to be the, what should I put the word? It is their own right to have those luxurious items. But for the people like us, it was a very, very costly commodity. My dear brothers and sisters, we all of us know what is the meaning of good health. Health is nothing but physical, mental, social, emotional, and spiritual well-being. According to me, the reverse, when there is no spiritual well-being in the family or in a person, it will cause emotional disturbances. When there is an emotional disturbances, that will cause disruption in social behaviors. Mental behavior. When he is disturbed mentally, naturally social fabrics will break down. All this put together, the person will start suffering physically. This is what I feel. Luckily, I should always thank God for giving all these 5 components intact in me. That made me the healthy and active man in this life. Let me describe how my habits and lifestyle keep me in these 5 elements. First, let me talk about the physical activity. Here I should remember and salute my wife. She is the root cause for everything in my life. And she was not only my wife, she was my guide, she was my mother. She used to feed me like a child, and she used to take care of that. All these, do you know? When I was a medical student, I was a regular visitor to the theaters to see a movie. How intelligently, without telling me, she changed my mind, and I gave up going to the theater. You will be surprised to know that in my 44 years of married life, I might have seen 3 or 4 pictures. That's all I have seen. She did not tell that you should not go to the theater. What she did is very intelligent. When I called her for a movie, she used to come. Within 20 minutes, she used to sleep there. Then looking at her face, I thought that I should not punish her. That's how I gave up going to the theater. Second thing is, I was a little bit crazy to go to the hotels. She started preparing delicious foods at home itself. And when the delicious foods are available in the home, naturally, I could not go to the hotel. And there was no necessity. Now we go to the hotel when absolutely necessity is there, we go. Otherwise, everything is prepared in the house. Let me tell how we changed our lifestyle. There is a small story here. She was just a young girl of 30 years. All of a sudden, she developed severe backache. And the doctors who have seen her, they told that the only possibility is surgery. We didn't want to go for surgery. We knew that surgery should be the last result. We should try something. To our luck or blessings of Swami, we got to know one very interesting personality. He's a naturopathist. And we met him. You will be surprised to know she was struggling to walk. And he just examined her and he pressed some 3-4 points and asked her to get up and walk. She told that I am suffering, I am feeling so much of pain and he's asked me to walk. To her surprise, just obeyed and started walking. And she walked not only few steps, she walked 100 meters and came back without pain. Then the whole scenario in our life changed. And he advised how to go ahead with our food habits and all those things. Then she became our leader in doing all those things. That's why I'm calling her as mother also. You'll be surprised to know that we are eating organic food since last 25 years. After that incident, we went for the organic food. We went where it is available. We tested the areas. We went to the field, whether they are really growing organically or not. And we did all investigation, inspections, whatever you call. And we succeeded in getting, and till now we are using organic food. Millets is our main cereals. Since last 15 years we are using millet as the main cereal, and we use it. There are so many millets, but once in a week she started changing the millet so that we should be accustomed to the different type of millets, and the taste is also a little bit changed. And my dear brothers and sisters, I assure you, if you start eating millet, it will be tasting like how you are eating the rice. So please switch on to millet. That is the best food available. And one more thing we started was we stopped eating sugar. Sugar is not available. Yes, we keep 1 kg sugar, which will be sufficient for 4 to 5 years. Whenever the guest comes and when they ask us, please, I need sugar, then only we will give sugar. Otherwise, sugar will not be used. We use only 2 things, either jaggery or honey for our sweetness. That is the thing that happens. Another reform she did was, she stopped buying maida. And maida preparations were not there in our family. Whenever we want to eat, without her knowledge, I go to hotel or bakery and eat little bit. That is all I can do is, but maida is not available in our house. That is how it happened. My dear brothers and sisters, our breakfast now, since last 10 years, is only morning breakfast is fruits and sprouted seeds. That's all the breakfast. Afternoon, yes, we will have a sumptuous food. She prepares millet rice there. Whenever I am in house, I eat millet rice. Otherwise, my food is in whatever is available in the hospital. But night, we will have a very light snack. This is our food habit. The thing is, I want to bring, she made one more change in our family is oil. We used to take refined oil before we met Jagdish, who is the naturopathist. And he advised us to stop all refined oils. We started using only filtered oils. And he advocated to restart coconut oil also we started. In our house, we use ghee, coconut oil, or filtered groundnut oil or sesame oil. Never sunflower oil and palm oil. The most important thing we stopped this, we never used, since last 25 years, we never use refined oil. I want to discuss with you one thing. I will give an example of groundnut oil. You know that 1 kg of groundnut costs around, minimum is 100 rupees. To get 1 liter of groundnut, we have to crush 2.5 kgs of groundnuts. What should be the value of the groundnut that we are using? 250 rupees. And there is a processing charge, there is a bottling charges. All put together at least, and the man should get some benefit out of it. It should be not less than 300 rupees. Do you know? The refined oil, groundnut oil, any oil for that matter, for 140 rupees, 150 rupees, we are getting that oil. Have we thought even 1 minute how we are getting those oils? According to me, they are not but the adulterated oils. Best thing is how we are not able to recognize it. They are all refined. When it is refined, the taste and the smell is out. So you will not be knowing, only you know that you have put some oil. That's why I sincerely request all of you to give up refined oil. Go for the whatever oil you want, whatever oil you usually use for a filtered, or we call it as ganade ennai, take it, that is going to be helpful. About salt. In our home, we stopped white salt since last 15 years. According to me, cardiologists may disagree with me, salt is not a wrong thing. Salt is essential for the taste. But what type of salt we are eating? We are eating polished or processed salt. It is nothing but a combination of chemicals. Please go for rock salt, which is available in the market. Yes, it is a little bit costly, but it is really useful for our day-to-day activities. Then, let me discuss about my physical activities. I usually get up at 4 o'clock and do a dhyana for 20 minutes and take 2 to 3 cups of water, both of us. I means it is not I only, always she is there. Without she, I is 0. Okay? That is the thing. Whenever I am lazy, whichever day I am lazy, this is very important to tell you all. When I become lazy, she will become very active on that day. When she becomes little bit lazy, that day I am very active. So that both of us will follow the rules and regulations. And every day, morning 5 to 6, we do a walking. A beautiful surrounding is here. And we used to do it in Bangalore also, and we continued here. That is the thing which refreshes us. From 6:30 to 7:15, we do yoga. She does at her home, I do in front of Premamrutham. This gives us very, our mind fresh. Do you know, every day we go to sleep at 9:30. Most of the time, my colleagues blame me for not taking the phone call after 9:30. I look at the phone number, If it is absolutely required, then only I pick up. Otherwise, I call them next morning. That's how I've done. Regarding the spiritual well-being, our family and also me is a believer of God. I always feel that God is with me. And my daily prayers, as soon as I get up, I used to tell my students that you practice that. Always I pray. I pray God and telling him that let your thought be my thought. Let your words be my words. And let your deeds be my deeds. And before sitting on my chair in the office, once again I call him wherever he is. I tell him, be with me and work through me. This is what I'm daily doing it. And when I go back at home, before going to sleep, I just thank him for all the good things that they happened. And I apologize him for any, mistakes that have occurred during the days. My brothers and sisters, you will not believe me. Ask my wife, she will tell. Within 10 minutes, I will be in deep sleep. I get up at 4 o'clock once again. This is my life. Regarding the emotional well-being, all of us know that we have 6 bad friends, not good friends. Kama, Krodha, Lobha, Moha, Mada, Matsara. That is the only reason for emotional disturbances. Yes, I am not out of that, but I boldly tell that since last 10 years, I have improved a lot. Whenever I get angry, that's a usual thing that happens. But now, most of the time, I withdraw myself for some seconds and I respond. I will not react. Yes, but sometimes I react. That's called I am overstepping it. Then, after a few minutes, I realize that I have done a mistake. I go to that person to whom I have spoken, whether he is senior or junior, I don't mind. I go and talk to him and tell him that I have made a mistake, excuse me. I don't hesitate to ask apology to him. But if I think that I am right, I call him and tell him once again that this is why I scolded you or I was angry. Please don't repeat that once again. This makes once this happens, I will be free of any problems. That's what, I am an alpatrupta. I don't have too much of desires in my life. Whatever I get, I just accept it. That doesn't mean that I will not try. Definitely I will try to get it. If I don't get it, I will not get disappointed. If I get it, I will just thank him, thank God for giving that. This is the thing that happens. As one big Shatru is always haunting me, that is aham. Still, I am not able to control too much of aham. As 60% has come down, I am trying it to my level best to bring it to 0 level. I am sure with the blessings of Swami and my perseverance, it will happen. Nowadays, I am hearing since last 2 decades, 2 words. I am sure you are also aware of that. One is stress, second one is the burnout. These were not familiarly we used to talk before. Since only from the last 2 decades we are using this word. According to me, yesterday Ram Mohan explained how the military people are working. If we think that that is possible, whatever we do is nothing. It is almost near to 0. So stress is only our these six friends' misused words. Please take out these words in your dictionary. There is no stress, especially for medical students. I am telling that nowadays I am listening from the interns who just joined as a junior resident. Murtyana, they have started telling that we are worked out too much and we are stressed and we are burnout now. There was no word. We used to work for 36 hours when emergency was there. If you love that profession and love that work, there is no word stress. Stress and appetite for work goes in a different direction. That's all I want to tell you all. About mental well-being, I meditate every day for 20 minutes minimum. If possible, morning and evening, at least once a day, I meditate. This is the thing that I am trying. My brothers and sisters, once again, I request you all, try to stop white rice. Use brown rice or millets. First preference is millet. If you can't do that, unpolished rice. Avoid maida and maida products. If you see bakery or bakery, don't look at that side at all. Nowadays, there is a habit in our hostels. Whenever there is a birthday, they will cut the cake. Cake is the worst thing that can happen. You purchase some fruits. You eat those fruits. Celebrate like that. Change your behavior. Don't think that cutting the cake is the way of celebrating the birthday. That is not the... Avoid sugar. Go for jaggery. Please, please, please stop using refined oils. That will save you your life. And if you want to avoid fried foods, if at all if you want to eat fried foods, prepare that in your own house and eat. At least you are eating with a fresh oil. That is what you have to do. My request to youngsters, stop Coca-Cola and Thumbs Up or any aerated, carbonated drinks. They are, to be frank with you, they are suitable to wash toilets, not for use as a drinks. Please don't use it. And stop using white salt. Use rock salts. And try always, and I must remind you, two things which we worship. One is Kamadhenu and Kalpavriksha. Whatever we get from Kamadhenu and Kalpavriksha are suitable for our health. People have, the Westerners made the politics, I should call that as a politics, and made that ghee is very bad, coconut oil is very bad. Now they have come back telling that that is good, after spoiling Indian population for 3 generations. At least our youngsters should get up and understand that ghee and this coconut oil is very good for our health. And daily do the physical exercise. If you can't do walking, do some exercise at home. And whenever is possible, try to walk. Don't use your 2-wheelers or 4-wheelers. Try to walk. That's very important. Do 20 minutes meditation. Most important is, please do, if you want to have spiritual equilibrium, do 20 minutes of prayer in the morning and 20 minutes prayer in the evening. Make it as a habit. If you don't make it as a habit, you will think that it's a punishment. And if you think that it is punishment, you are fit to come to our hospital, not as doctors or any visitor, as a patient. Please, if you do all those things, I am 100% sure that you will not visit our hospital as a patient. You will be always have a lengthy, healthy life. I hope you will follow at least few tips which I have given. You have to follow, because look at us. I am 70 years old and he is 80 years old. Whatever we have told is our experience. 81 already, sir. So please, if I am sure all of you will follow this and you will be healthy. And thank you for giving me the opportunity. Sai Ram to you all. Sai Ram.
Student speaks standing. I should also speak standing. I had the option of sitting there and speaking. A mic has been kept there, but I chose to stand and speak. Dr. Agarwal had warned me while we were coming in, all the programs are going on time, and how much ever time is given to you by Raghupati out of 30 minutes will be your time, right? So he spoke for 30 minutes. Therefore, I have to speak for 0 minutes. No, what is the next program? Okay. On listening to Raghupati, I remembered a real life anecdote which I had heard. It seems somebody like Raghupati lived for 100 years. I am sure that he is going to live for 100 years by God's grace. And naturally it became a talk of the town. Somebody lives for 100 years and it's a talk of the town. And a few journalists came to his home. We want to interview you and publish. He said, fine. What is the secret of your healthy, long life? He said, like Raghupati said, no smoking, no drinking, no gambling, no stimulants or narcotics, and no flirting, he said. Then one of the journalists asked him the second question, then why did you leave? What were you doing? If you did not do all this, what's the reason for your leaving? But another person asked him, were you married? He said, no. Then that journalist said, that is the real secret of your long life. So this centenarian asked a question to the journalist. Why do you say that? Sir, I was very healthy before marriage. After marriage, I developed blood pressure first, and all the siblings followed. That's what he said. But you know, that's a joke. I did not take any medicine till I was 50. I played cricket till I was 60. Till 70, I never visited any hospital for my sake. I've taken my students or someone else to the hospital. I never visited a hospital for my sake till I was 70. Till 75, I used to travel every year at least to 30 countries minimum, till 75, between 70 and 75. And at 80, I'm not so strict about food. I still enjoy my meal once a day, and I enjoy my morning walks also. If you ask me what is the secret, all the secrets he has already spilled. And yesterday, our Sadguru Sri Madhusudan Sai spilled one of my important secrets when he said, Narasimhamurthy is going to share his experiences. But if you ask me, what is the secret of his good health? I would say it is surrender to God. That's what he said. That is the thing. I was never as strict as Raghupati. I led a really very happy, nice life, eating whatever I liked. But God kept me very healthy because this is the secret. I am doing God's work and nothing else. That is the real secret. When you decide to work for God, it becomes God's responsibility. You need not have a list of do's and don'ts. When you have faith in God, devotion to God, and finally surrender yourself to God, your health is God's responsibility. It is not your responsibility at all. But first I should thank my parents. We are a very big family, a full cricket team, 11 children. Full cricket team. But in spite of not having much wealth, they sacrificed and gave us very good, nutritious food when we were babies and kids. That is the most important thing. See, whatever you may try to do, suppose your parents have not given you good, nutritious food. Definitely, in childhood and boyhood or girlhood, whatever, naturally, you can't lead a healthy life. Therefore, fundamental thing is, next to God, our parents who have fed us well. If we are healthy, they have fed us very, 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 very well, I would say. And I don't have any other secrets other than what Raghupati said. But the real problem is, how many people do not know that these heart problems, BP, sugar, or lifestyle disorders, how many people do not know? Everybody knows about it. Then what is the problem? There is the Duryodhana syndrome. I know what is right. I don't have the strength of mind to follow the right thing. I know what is wrong. I don't have strength of mind to eschew, to avoid the wrong thing. See, that is the real problem. Therefore, if at all anybody wants to help our younger people today, first thing we have to do is tell them how to cultivate strength of mind. See, it is a really vicious circle. If we want to get spiritual strength, you have to give up wrong desires and habits. But if you want to give up wrong desires and habits, it requires spiritual strength. In Kannada, there is a proverb, ಹುಚ್ಚು ಬಿಡದೆ ಮದುವೆ ಆಗೋದಿಲ್ಲ, ಮದುವೆ ಆಗದೆ ಹುಚ್ಚು ಬಿಡೋದಿಲ್ಲ. I think many of you didn't follow Kannada. How many of you have followed what I have said in Kannada? Both sides. You don't know Kannada at all? None of you know Kannada? Oh my Lord, only one. Okay, very few. Therefore, I will translate it into English. It seems, young man, like many young men are, he became crazy because nobody chose to marry him. He became crazy, became mad. And he was wondering what will happen to me. Because the problem is, unless his madness goes, nobody will marry him. The real problem of this boy is, unless he gets married, his madness will not go. So this is our problem. If you have spiritual strength, you can give up wrong desires and wrong habits. But if you have to gain spiritual strength, first you have to give up wrong desires and habits. Where do we start? The solution as given by Adi Shankaracharya is satsangatve nisangatvam. Good company, you have to choose good company. If you are in the wrong company, you will never be able to give up wrong desires. So what is good company? Company of people who lead a life like Dr. Raghupati. And after listening to him, I understood why the wife is called the better half. Because he accepted he is the lower half. The point is, you have to have right company. See, especially Raghupati is very, very fortunate that he joined our school in Alike long back to 8th class. And I looked after him at that point of time. It was such a great company. We had a great leader in Madhyal Narayan Bhatt who led an exemplary life, absolutely exemplary. Good company helped him, laid the foundation. And later on, his parents are also, I visited his house where he lived, Kammaradi. Very beautiful place. Shimoga district is a very beautiful place. Naturally, his parents also looked after him very well. Therefore, good company means what? Then you may say that, say, where do I get good company in my town, in my place? Where do I get? See, here there is good company, but where do I get good company? Good books, good music. These are this is good company. Once in a way, you also keep in touch with a person who leads a pure life, who leads a very healthy life, who leads a life of fulfillment. See, this is very, very important. And to cultivate spirituality, the easiest thing is, suppose you ask a young man or a young girl, young lady, oh, you get up in the morning at 4 o'clock, have a cold water bath, then meditate for 20 minutes. Nobody will do it. You go to temples, not many people may go. Then how do you know there is joy in spiritual life, whether there is happiness in spiritual life? Easiest, you can experiment it. Anybody can experiment. Even if you don't have belief in God, you can experiment. When you help someone without expecting anything in return, whether you believe in God or not, God in your heart is immediately happy and you become happy. See, that is spiritual happiness. If you ask me, apart from divine grace, what is the secret of my good health and relatively long life? It is nothing but all my life, I took great joy and happiness in helping people, in serving people, especially the poorest of the poor. And who taught me this? I didn't learn from any Bhagavad Gita or Vedas or Upanishads. Not any great teacher taught me this. As a boy of 10 years, I understood this because I learned this lesson at the feet of my mother. She was very kind. I will just tell you one anecdote and close there. See, my father being a very honest officer, revenue officer, every 2 years he was being transferred. Every 2 years without exception. And therefore, our schooling happened in 7 schools in 7 places. I studied in 7 schools to complete my 12th. And once, when I was in 6th class, possibly, or even 5th class, maybe 10-year-old, we lived, my father was serving in Sidlagatta, which is a town just about 20 kilometers away from here. Chikballapur is our native place. We have a house in Chikballapur. And there was one person whom we call today, scheduled caste person, who used to clean our toilets in Chikballapur. His name was Mutyalappa. He was very sincere. One day it happened, one evening around 5 o'clock, he landed up in our house in Sidlagatta, 20 kilometers away. My mother was there, father had not returned from the office. And my mother asked him, why you have come here? He said, with so much of reverence for my parents, both mother and father, and he said, I am performing my first daughter's marriage. I wanted to seek help from you. She said, let's wait. And I was at home with my mother. Nobody else was there at home. And then my father came. See, he was a very short-tempered person. Maybe something had happened at the office. And as soon as he saw this fellow, he shouted at him, why did you come? He said, Swami, I am performing my eldest daughter's marriage. I want to seek your help. He shouted at him left and right. He threw him out of the house. Get out of the house. Why did you come without telling me? Things like that. See, those days appointments were not known. With great reverence and love, great hope he came. And my father went into bathroom to have a wash. My mother went into the puja room. I followed her. She was crying. I also started naturally looking at mother at that age, you will also cry. Then she said, see, in houses of pious people in the puja room, there is a small pot kept. Whenever something goes wrong in the house, the mothers pray to God. God, please help us to get rid of this. Maybe ill health or this or that. And I will give you some money. Harke, Kannadadalli harke ante heltare. And it was small pot was full. She emptied the pot into a piece of cloth and tied it up and gave it to me, run to the bus stand and hand it over to him. And then she said, if he asks who gave, you say, my father gave it. I ran to the bus stand. The old man was still crying, sitting in the bus stand. I handed over. He was so happy. Who gave you? My father gave. His joy doubled. That day I learned, and I derived so much happiness that day. It was not my money. But just because I did what my mother asked me to do, did little help to that gentleman, I felt very, very happy. That day I learned the secret of selfless service. I didn't expect anything from that old man. I didn't expect anything from that old man. When you help somebody, whoever it is, in the family, outside the family, in your town, in your office, wherever, but you should not expect anything in return. Not even recognition, not even a pat on the back, not even a word of gratitude from the person whom you help. Then immediately I tell you, you get spiritual happiness in your heart. Therefore, finally, if you ask me what is the secret of my good health and really a good life is, one is God's grace. Second is my passion to help others, whoever it is, without expecting anything in return. Thank you very much. Sairam to you. Sorry, Agarwal, we delayed you, I think. 20 minutes. Okay.
Thank you very much, sir. I request Dr. Hiremat to please come and extend a token of our love to both of them. Our gratitude to both speakers for enriching us with their insights and wisdom. Thank you. We now move into an interactive session designed to be a more reflective part of the day. This is an opportunity for all participants to engage in group activities, share insights, and explore key takeaways from the session so far in a more personal and practical way. The session will be coordinated by Ms. Sheila Awad and Mr. Vijay Sai. They will guide us through the process. I invite them both on the stage, please. Mr. Vijay Sai and Ms. Sheila.
Hi, good evening, everyone. Okay, we're going to have a shorter session, a little bit shorter, so we hope you guys will participate actively. This session is really to recap for you all the pointers that we have acquired over the last 2 days, as well as share with our audience and those who are dialing in and watching live on Zoom or YouTube, the benefits of little steps, big steps, habit changes, and tips on how to maintain a healthy heart, and prevent the onslaught of any heart ailments. Anything to add, brother?
So basically, all of you have got too many points. So if I ask you, what will you do? You don't know where to start, where to begin. So we thought we should help you put them all together and be able to have it in a way, because whatever we hear, we forget. Whatever we see, we remember. Whatever we do, we understand. And so we wanted you to get into this activity, to be able to remember, so that this particular conference, the takeaway is imbibed in all of you. So how do we go about it? Could you project the slide which I gave you? We have come to a particular activity.
Just one, before we start, just to check, how many of you do not understand English and you would need translation into Telugu or Kannada?
Yararge pure English baralla, Kannada mele Telugu translation beku? Or there's nobody?
Okay, none. Excellent. So great. So I take it all of you understand English and we don't need to pause to translate into Telugu and Kannada? That's great. One more time. Anyone needs translation? Brother Vijay is fluent in Kannada and Telugu and he will help translate. Anyone requires translation? We can do this activity in your mother tongue and then we'll translate it when you share. Anyone needs that? Okay, great. Then very simply, we're going to do this. If you can divide yourselves, just bundle together, huddle together in maybe groups of 5, since we don't have that many.
Groups of 5?
Yeah. So groups of 5, huddle together, and all we want you to do is this simple activity. You are working in a very interesting organization.
Give it to each of those groups.
Okay, you get into your groups and then we will give you the instructions.
Give one. Give all of
them.
We have papers and pens for those who haven't brought. He'll be giving one for each of you so you can put it together, consolidate it.
Do you need any more? I have some more. You think enough? Okay, if you need any more, we have more papers and pens backstage. So, yeah. Maybe girls. just we give the girls this. They all have.
Have you all got into groups of fives?
Okay, so no need. Okay.
Okay.
She says the girls all have, no, the girls all have pens.
Okay.
Okay.
Yalla kutkondra, all of you in groups of 5 or 6?
Okay, just anyone who is still looking to join a group, or are you all settled in your groups? Anyone need a group? Put up your hands. We will allocate one to you. Okay, great. Okay, Brother Vijay, do you want to give the instructions?
Okay, so we have doctors also participating. We have students also participating. We have the delegates also participating. The guests also participating. Fantastic. So from yesterday, you listened to different lectures of different people talking about how to prevent heart attacks in young adults. So we have a situation. A young, enthusiastic high performer has recently joined your organization and you have been assigned to mentor him. He tells you that he's concerned about the recent increase in heart ailments amongst young adults and asks you for tips to prevent getting heart ailments. So each of you think of 3 tips which you can give. The 3 tips need not be what we have discussed yesterday and today. They can be your grandmother's recipe.
Yeah, maybe I'll continue. Yeah, I'll just add. Yeah, so okay, so the 3 tips can be any family, community, village, culture, any tip that grandmother, great-grandmother has been implementing, like Dr. Raghupati has been sharing, any tips at all. Okay, the point is, as Brother Vijay said, each of you write down 3, but for time efficiency, because lunch is fairly soon, we request you, we will give you 10 minutes to brainstorm amongst your group. If we can do it in 5, even better, your tips. Amongst your entire group of 5, we'd like you to pick the 3 best tips that you all collectively agree, and then we will come down and bring the mics and ask you to share with the rest of the audience the 3 best tips your group agree, and I think collectively we will walk away with some repeats, but maybe some interesting new tips as well.
And if some tips are repeated, then you can go to the 4th tip and 5th tip also, if you are having the same common things. So come on. First, rather than discussing, write down your own individual tips that you have. Each of you have a pen and a paper. Write it down for about 1 minute and then start your discussion.
Yeah. So let's say we will target 6 minutes then and see if they're ready so we can start sharing. 6 minutes from now, we will interrupt you. Go ahead. Thank you. We are 5 minutes down, so we have the last 1 minute. Does any group need more time? Does any group need more time? Or are you ready to present in 1 minute? Any group needing more time, please raise your hands. Okay, great. So in 60 seconds, we will ask you to stop, sit, and I'll go around, and Brother Vijay will go around with the mics. We will do one male group and one female group alternatively. All right? Okay, great. Thank you.
Are the boys ready? Okay, we start with the students. Yeah. Who's going to be a spokesperson? Give it two more minutes. Okay. Here. 2 more minutes. Susheel, all of them want 2 more minutes.
Can we do 1 minute? We already almost 8 minutes now.
Ready, Adra? 1 minute, Becca. Mad. Who's the spokesperson here? You. Okay. Sister, we start with the students first. 1 more minute, 1 more minute. They'll not listen.
We'll start with students.
Last 60 seconds before we begin. Thirty seconds more to begin. Ready now? Yeah, you can give it to her.
Okay. Can I request everyone to settle down a bit so we can have silence and listen to the presentations? Thank you. Brother, you want to start with the girls or the boys? Okay, we'll start with the sisters and we will alternate sisters, brothers until we're done. Okay, thank you. Please share by introducing your name and share your tips, your group's tips. Thank you.
Sairam to everyone. My name is Akshata MJ, currently pursuing final year in BA Vedic Studies. So in the group, what we have discussed is the 3 aspects or the 3 major tips. That is, one is lifestyle and changing your food habits and stress management. In lifestyle, reducing the screen time. Usually in the social, whoever has the phones or whoever has the laptop also, most of us try to scroll either in the news or updates, anything. So that screen time should be also reduced. Doing regular yoga and meditation. Usually, since it is cold weather, we tend to sleep after Suprabhatam or we tend not to get up itself. So we should, despite of having this all predicaments or laziness, we have to overcome it and we have to do yoga or meditation. Healthy relationships. So it's about here also and it's about outside life also. We tend to spend time with more screen or phone instead of spending with our friends, sisters, or parents. So we have to spend more times with them. Yes. Then changing our food habits. As previous Raghupati sir told that to replace the sugar with the jaggery. If not jaggery, we can replace with the brown sugar and using the coconut oil instead of sunflower oil and more water. It should be, we should be always hydrated. And last, the stress management. So majorly why stress comes, it is because of loneliness. We misunderstand what is loneliness and solitude. Try to replace loneliness by solitude and acceptance and letting go. Since the question was an enthusiastic youngster, so he has to accept the things and let go in anything, relationships or whatever the situations is. And making the friendship with the mind. Usually we tend to go against our mind, but we have to slowly make friendship with mind. Thank you. Thank you.
Very
Thank
good.
you. Thank you. Give them a round of
Thank
applause.
you very much.
Can
Here we go.
Sorry, 1 second. Can I request everyone to keep your answers within 2 minutes so we can hear the sharing from all the groups? Thank you very much.
Saram, my name is Chinmay. I am currently pursuing my second year diploma in integrated agricultural sciences. You know, regular physical activity at least for 30 minutes is necessary, and moderate exercise, walking or jogging, cycling, like that. And we should follow a healthy diet, eating more fruits, vegetables, and millets, nuts, etc. Avoid oily foods and manage stress effectively. Taking break from screens or your work, and get quality sleep at least 7 to 8 hours, and stay hydrated. Drink more water throughout the day. Healthy relationship and stay connected with everybody. Thank you, Saram.
Very good.
Thank you.
It is said, brevity is the soul of wit. A big round of applause for keeping up the time and covering all the points. One more round of applause for him. Now let us see whether the girls can keep up the time. The next group.
Yes, thank you for keeping to time.
Salam everyone. So just by controlling our mouth and mind, we can manage these risks. So for mouth, we have to follow our food habits like she explained already. And for mind health, as Sir explained yesterday, we can start our day with some gratitude notes. 5 things what for we are gratitude for, we can write in the morning. And we can end our day by writing positive things about us. Then we can, Hoponopo we can do for the people who we have some conflicts. So, this one.
Thank you. Thank you very much. Well within the time, give them a round of applause.
Yeah. Who's
Brother,
here?
over to you.
I am Tejas from Diploma in Integrated Agriculture Sciences. I am pursuing my second year. First, to maintain our health, we should be in self-discipline, because whatever we take or eat, we should not neglect. Like if you want to, example, we are not feeling well, the doctor gave us tablets or solutions, so we should take on time. We should not delay anything. Even in our diet, after a morning meal, we should not shift into the next meal. So we should be, first of all, in the self-discipline by saying this. Thank you.
Thank you very much. Fantastic. Thank you, Tejas. Yeah.
Over to the girls.
Sairam, our 3 tips are active participation in sports. Participating in daily activities will reduce our obesity and fatigue. And next is controlling desires. We should control our desires, which helps to not think more. And moderation of food. We should consume food as much as we can, not more than our ability. Thank you.
Thank you very much. Round of applause for the girls. Over to the boys.
Sairam, my name is Abhishek from Diploma in Integrated Agriculture Sciences. Accept the every situation and be calm. Be connected with the nature and love everyone. Be positive and think positive. Thank you. Jai Sai Ram.
Thank you for keeping it very short. Yes, sister, there. So, Sister Sirisha is presenting. Yeah.
Hello, hi, Sairam. Yeah, early to bed, early to rise. So that's one good thing. Doing yoga, meditation, exercise, discipline in taking food, stress management by doing pranayam, quality of time with the family, and screen management.
Thank you. Thank you very much for keeping well within the time. Most grateful. Shall we do this group, the ladies? Yes.
Sairam, my name
Okay.
is Preetam.
Sorry. It's brothers. Sorry.
My name is Preetam. I am from Agriculture Sciences. The three strong tips to maintain health. Having hobby of playing games and spending time with pet and domestic animals. Example, visiting to the Goshala. And please spend good times in temples by chanting God's name and also Omkara, and have good smell of camphor. Most important is mental strength and feeling positive and self-confidence. If you are mentally strong as well as physical cleanliness is very important.
Very good. Special tips. Animals will reduce your stress. Beautiful. Thank you very much.
Thank you very much. And the ladies, please.
As he is over ambitious high performer and he is afraid of the heart risk, we'll take into consideration how many hours he is working, and then we'll do his basic metabolic investigations, and then we'll ask about his sleeping hours, and then we'll ask him to cut down his work time, how many hours of screen time he has or any computer time. And then we'll ask him to sleep early, get up early, do yoga, meditation, pranayama, and have a protein-rich food, and also have more of liquids. And meditation is most important, and be happy with all his colleagues and try to learn from his seniors also, juniors also.
Thank you. Very good tip. Be happy to learn from your seniors and your juniors. Thank you, Sister Sairam. Over to the boys.
Om Shri Sai Ram. My name is Daivik. I am currently pursuing my integrated agriculture first year. I am talking, you should not use oil they are putting more adulterated. You should use cold pressed oil and other oils which is good for our health. Especially everybody will eat hot chips. It is very dangerous for our health. Go check their hot chips and take the results. It is very dangerous for our health. And you should check all ingredients before eating. You should see back of your Good Day biscuit. They gave now Good Day biscuit and other juice, right? In juice, only 0.2% of chocolate was added. Nothing was there in that. It is nothing, but it is harmful for our health. Be careful. And another one, who will be very who will be doing his job works, they will think about money and other things. Don't think. See, our sports person, they will do daily meditation and other things. You should also practice meditation and other all works. It is good for our health.
Thank
Good.
you.
The confidence of the cold pressed soil which nobody else raised. Great. Thank you. Yes.
Thank you. Over to the girls. Please keep to the 2 minutes. Thank you.
In your working place, you place a plant which by seeing it you feel like refreshment. You get refreshment. And then the second one is after your work time, you practice hobbies which you like painting, practicing music and other things, and have a good smile on your face. That makes more sense than any other thing. Sai Ram.
Great tip. Thank you. after work, practice hobbies like dancing, music, painting. That's a great de-stressor. Thank you very much.
Hobbies
Over to
doesn't
the
mean
boys.
watching television. Think of the hobbies that she spoke about, okay? Yeah.
Saram, my name is Sathya Pramod. The three things are sweating daily by doing physical activities, and second thing is maintaining proper diet by using the method of plate sharing method, and third thing is monitoring our body by doing our activities, and fourth one is colorful fruits and vegetable by proper in time and eating 75% of our food daily.
Thank you. I'm so happy that I sweat even without doing any activity. Thank you so much. Yes.
Thank you. Over to the girls.
My name is Harika, and pranayama and yoga will help us to stay strong and fit. Usually we will not focus much on breathing exercises, which will help us to stay calm and which provides peace and mind. If we focus much on these aspects, it will help us to maintain the harmony between the mind and mind. Thank you.
Thank you. Well done. Thank you very much. Over to the boys.
Very good afternoon to all. Myself, Anand Kumar, as I'm working in sales officer in Nesium Edible Oils. Presently, we have to maintain some good health means, majorly, regularly we want to use good oil. That I prefer the gingerly oil, which is best for your heart. And not only that, the second tip is get moving, aim at least one this per day, 30 to 60 minutes jogging we have to do regularly. It is regular activity for everybody, for the children to family. Whether we have to, this activity we participate with the family, it will be very good and it will be very good health for the second tip. And the third tip is regularly walk minimum 5 to 6 kilometers. And regularly we have to drink minimum water 3 to 4 liters. And not only that, we have to be very actively to maintain smiley face and to be very active always. Thank you.
Thank you. It's coming from Idayam Sesame Oil, from the employees from there. Fantastic tip, sir. Thank you very much. Yes, sister. Sister, at the end of it, you must give 3 tips. I'll also give 3 tips. So be ready. Yeah.
Okay, Sairam. Sisters?
I put her in pressure now.
My name is Regina, and first, to manage your stress, you should do yoga, pranayama, and meditation, and very good is sports and activity for your body. And then you should concentrate on a healthy diet and avoid processed and fast food. Your diet should contain also raw food and sprouts, and avoid sugar, don't use refined oil, and little salt. And then you also look for good company and concentrate on the divine, find peace in your connection to God.
Thank you very much. So that's a very nice tip that sister added. Find joy in your connection with God. Good company and your own inner company are crucial to mental well-being. Thank you very much, sister. Over to you.
Sairam. I'm Vinay from the Department of Life Sciences, and our group here, we did a thing and we have come up to a conclusion. Here are some of the tips. There's something called a scientific pranayama. You practice that. Meditation too, yes. Apart from that, food, lifestyle does help. But at the energy level, please practice affirmation, gratitude, and use music and help it heal your chakras. Just as brother taught us yesterday. Practice this and you can be a better individual. And not only that, you'll find yourself in a greater plane. Thank you. Grateful to you.
Thank you so much. He's been practicing it regularly. Thank you very much. Yes, is Sheila,
Ready?
somebody there?
Yes, yes.
And after that, there are two people trying to escape, Padmaka and Vidya. They all should tell three in the end.
Okay, I'll go over again. Them.
Yeah.
So be ready, ladies, please.
They're relaxing. I don't want them to relax.
Come on, quick. Okay, who's ready?
Sairam, as many points has been covered, we would like to give 3 more tips. And going into the woods, spending some time in nature, as it is a natural healer, physically and mentally, and traditional way of doing household activities, as we replaced with many electronic gadgets, doing traditional works, which unconsciously, which helps you to maintain your physical activities, and having seasonal fruits and maintaining lifestyle. Thank you.
Thank you, Sairam. So those are new additional tips in addition to the ones given. And seasonal fruits is a great idea because often we think we need to spend money in buying expensive fruits. Not necessarily so. Some of the healthiest fruits can be grown in your backyard. So seasonal fruits, great idea. Thank you very much. Over to you, brother.
So additional tips I would like. Yeah, myself, Dr. Praveen. I'm a faculty of community medicine. So first of all, we need to reassure this young man. We need to educate him on the risk factors and we need to assess his risk factors. Then the second point is lifestyle changes that already told by the many of the participants. And the third one important is socializing with the friends and family. At least he need to spend some considerable time with the friends and family in addition to his busy schedule. And the fourth one, so incline towards spirituality and be content with the life, whatever I have. And the fifth one is moderation in everything. So whatever the work and whatever it does, you should have a moderation. Thank you.
Thank you.
Thank you. Inclination towards spirituality. When I tell that outside in the corporate, they think it is having spirits on Friday. But luckily here we know what is true spirituality, understanding your own divinity. Thank you, sir, for sharing. Yes, Sister Sheila, next person.
Om Shri Sairam. My name is Dhanushri. Our small 3 tips are like avoiding continuous sitting diseases and practicing acupuncture and involving in spiritual things. Thank you.
Great. So the new thing, spiritual, has been discussed, but acupuncture, right? Acupressure includes foot massage, palm massage, and pressure point massage, which is really very effective in energy flow and clearing your nadis and getting your chakras working. Thank you very much.
The heart point in the ear, auricle, the heart point in the hand should be pressed. Fantastic. The good point, somebody should consider that. Yes, sir.
Namaste, I am Pratap. So the problem with being last is that, you have covered almost all good points. So we are left with some of the subtler ones. So one thing I think which didn't cover was hurry, worry, curry need to be avoided.
Hurry, worry, curry. Lovely.
And obviously, if you have to stay happy, follow the advice of elders, spiritual leaders, etc. And very importantly, selfless service brings happiness. And one other thing is, please don't follow don't do's. Do with awareness. So whatever we feel that we should not do, don't stay away from it. Do it with awareness. It will wean off. Thank you.
Lovely, sir. Hurry, worry, curry. Do it with awareness. And one more point. Service secretes serotonin, and automatically it's a remedy for heart, sir. Thank you so much. Dopamine you'll want more and more. Serotonin will make you feel it's enough. I'm satisfied. Thank you for the sharing, sir. Yes, Sheila.
Thank you. The girls are sharing.
Om Shri Sairam. My name is Stravani. I think to remove stress, we should participate in social and service activities. And the other thing we can do every day is laughing exercise. That there is a quote, no, laughing is the best medicine. So we should laugh every day, minimum 5 hours. Thank you.
That's a great tip. We should laugh every day. I don't know we can hit the minimum 5 hours, but we'll start by laughing every day. Thank you very much, Sairam.
Om Dhanvantraya Nama, Sri Sairam. Myself, Dr. Gnaneshwar, Principal, Ashwini Ayurveda Medical College, Davangere. So all my brothers and sisters have been told everything. So on a discussion of my 3 new friends and 1 old friend, we are being made at 3 points. That is, first one is, according to alternative medicines, what Sir has been told, and definitely Ayurveda, that is, all the diseases will be by an Sarvopi Mandagnihi. That is related to a metabolism. So on that basis, I will advise those who came for these heart issues, I will tell them 2 pieces of garlics before food. As that it is mainly, this garlic will do the Deepana and Pachana. That is, it will stimulate the gastric juices are related to a digestion at the cellular level also. Second thing, I will advise, take 2 banana at night time, because the input and output is very important. Most of all, if we see in a cardiac patients, the constipation will be the common thing, so that it can be relieved by this banana. And if persist, you can add a Triphala Churna, where we will get in all the stores and in provision stores also. And lastly, that is a third point, that is, you should wake up in a Brahmi Muhurta. As like that often, we all know that we are a medical faculty and etc. Every organs has been a time to active. So the large intestine in an Brahmi Muhurta is active in that time, and for an evacuation of the stools, etc. So these are the 3 points. And be plan. When you get up, plan your day and be with happy and smile. Thank you. Thank you very much.
Thank you very much. That was a big Jnana Bandhara from Mr. Gnaneshwar, principal of the Ayurvedic College. Very simple to do. Bananas in the night, cloves of garlic, because it's going to help you. And finally, he talked of Brahma Muhurta. So whether you don't know, our students automatically get up every morning at 5. And that's why they're healthy and happy. Thank you. Yes, sister.
Thank you.
Sairam, all of you. I got just 1 point. To be calm and composed in times of sorrow and joy. To stay calm by listening to spiritual speeches and play games. When we play games, we might win, we might lose. As Swami says, we should not take it seriously whether we won or whether we lost. We should just think we have participated. That gives us a sense of to be calm and in times of sorrow and joy. This keeps our heart healthy.
And keeps us stable, right? Thank you. Well done. Thank you, ma'am. Okay, thank you. Over to you, brother.
जी नमस्कार. कुछ शब्द ऐसे रहते हैं जिसका अंग्रेजी भाषा में अनुवाद नहीं होता, जैसे धर्म का अनुवाद नहीं है, वैसे ही ये स्वस्थ रहने का और ये हेल्थ, ये दोनों पर्यायवाची नहीं है, सिनोनिमस नहीं है. स्वस्थ का अंग्रेजी भाषा में कोई अनुवाद नहीं है. स्वस्थ का यहाँ जो हमारा भारतीय परंपरा में है, स्वस्थ मतलब स्वयं में स्थित होना. वो स्वयं में स्थित होने के लिए, जैसे हमारे डॉक्टर रघुपति जी ने बताया कि हमारी स्पिरिचुअल हेल्थ ठीक रहेगी तो इमोशनल हेल्थ ठीक रहेगी, मेंटल हेल्थ ठीक रहेगी, सोशल हेल्थ ठीक रहेगी और फिजिकल हेल्थ भी ठीक रहेगी. तो मेरा यही कहना है कि हम मॉडर्नाइज तो हो पर वेस्टर्नाइज नहीं हो. अपनी जो भारतीय ज्ञान परंपरा है उसमें जो स्वस्थ की परिभाषा है उसको फॉलो करें.
Thank you, sir. Thank you. Any more points from this group? Doctors group? Yes, sir. Thank you very much, sir. Swa is staying with yourself. Very good, sir. Thank you.
I'll summarize for the group. So we did a start, stop, continue thing. One thing that he should start, one thing that he should stop, and one thing that he should continue. So start, we wanted him to start. Dr. Susheel Sharma brought a very good point. He said, even with lifestyle changes, nothing may not change unless you know, you're aware of your physical condition, your medical condition. So he said that medical checkup is very important. So that you know that you have got any health conditions or not, or genetics or environmental factors. So start medical checkup. Stop, he had a very good point that while we should know what diseases we have, that should not make us anxious and fear, because that adds to the stress that I will get a heart attack, I will get a heart attack if I keep on worrying about it. So stop having anxiety and fear, which is already having as per the case study. And continue to be enthusiastic, because that mentioned that he was very happy and enthusiastic kind of a person. So he should continue to be happy and enthusiastic. So these are the three things.
Thank you very much, sir. Thank you for the unique points. Thank
Okay. Brother, I'm going to pass the mic to the girls. If they just have anything to add due to time constraints, we request you to just add on anything that has not been raised.
We have two more groups. Just two more
so
groups.
maybe
Doctors group.
we'll ask them to add. We'll alternate, but we'll just ask them to add on anything new that has not been raised, if that's all right.
This is the group that asked first. I told them you're a doctor's group. I'll do last.
Okay.
So 1 second. Yes.
Okay. Amongst the people who spoke, right, only 4 of them said to him the case study. Rest all said me, I, and all those things. I will do, we should do. So I would like to summarize with 3 steps. One with the head, one with the heart, and one with the gut. Take care of your mental health. Talk to your therapist. As I'm a psychologist, I'm saying this. Talk to your therapist. Get to know about why you are being affected. Is it just a physiological complaint, or is it psychological as well? There is a relationship between your mind, body, and the head, heart, and your gut. We should be aware about how these 3 are interlinked for us. They are trying to say something to us and we are not understanding. So this is where I come from, sir, and this is what we all spoke about. The diet, as we all know, and head, heart, and gut is what I need to focus on. Thank you so much.
Thank you so much, sir. Thank you, doctor. Thank you.
Okay.
Yes, sister.
Yeah,
Go.
thank you. So I'll pass the mic now to the rest of the girls. So please add on something that has not been raised if it's on your list. If it's not, just pass the mic back to me so that we can stop in time for lunch, okay?
Sairam, this is Samruddhi. I'm from NKH campus. So I just want to speak slightly from a spiritual context. First, we should have Shama and Dama, means having control over our mind and senses, so that we can we can eat good food, limit our food, reduce screen time, and have control over our emotions. And next, we should spend our time with nature, so that it teaches us many lessons, and you can spend time with yourself. And yesterday, Vijay sir had told that front heart chakra and back heart chakra will be blocked because we are unable to love others, and because the love we expect from them, we are not getting. So when you see yourself in others and others in yourself, you will love everyone, so that it will decrease your heart diseases. Thank you.
Thank you. Thank you very much. I'll pass it to the next group.
Yeah.
1 second.
I think I can just add one particular thing everyone has told, but गाना आए या ना आए, गाना चाहिए. Be it bathroom or be it anywhere, आप दिल से खुल के गाओ, right? Your nitric oxide, everything will start. बेसुरा भी गा सकते हो, कोई बात नहीं है. But if you open up, आपका जो है पूरा release हो जाता है. ज़रूरी है, right? Thank you.
He's talking of singing songs, whether you're in a bathroom or other. I would like to add sing song, but not dard bhare geet. Yeah, thank you. Yes.
Okay, thank you.
Sairam, I'm Rakshita, currently pursuing my final year BSc.
I would like to add that previous speakers mentioned about practicing exercise on daily basis, but it is paramount important to do it in a proper sequence. Example, in Surya Namaskara, we tend to focus only on steps, but it's crucial to focus on our breathing pattern also. Otherwise, it affects us adversely. Thank you.
Thank you. Thank you very much. Guys, you finish? Okay.
Sairam, I am Pragati. The 3 tips which we have discussed is 3 M's: meditation, mindfulness, and moderation.
Meditation, mindfulness, and moderation summarizes quite a bit. Anyone else? Brothers, any more left in your side? Okay. Okay, sure.
Sairam, my name is Meghana. Following Ho'oponopono, we can build our good relationships. Having minimum 3 hours of gap between dinner and sleep by avoiding late night dinners. Through love, we can be with patience with others. And spending time with nature, it reduces our stress. Thank you.
Thank you very much. Another good reminder, 3 hours after dinner, you sleep. So which means you sleep early and eat early. So there's a gap of 3 hours between your dinner and bedtime. Great reminder. Thank you very much.
Sairam to all. My name is Varsha. I am pursuing my first year BSc. Consuming good amount of water, it is natural healing agent. And sitting is a new smoking, as they say. And instead of sitting for too long, we can take a small break and do some activities. Maintaining balanced diet. Any diet which contains all the necessary nutrients, which will help us for proper functioning of the body. Thank you.
Sitting is a new smoking. That's interesting. Thank you.
Guys, I request you to just add on to tips. If it has been given, don't repeat. How many more left? How many more groups?
I'm Manvita, trying to be always positive as proton and consuming food as medicine, finally taking from scriptures, tenak chiktena bunjita. Consume with sense of gratitude and sacrifice.
Great reminder. Consume with sense of gratitude and sacrifice. Don't take more than your fair share. Thank you.
Om Shri Sairam. My name is Jayashree. Most important thing is having total faith in God, which helps us to overcome many challenges in our life. Thank you.
Faith in the Supreme Being will help you stay healthy and steady. Any more tips? Did I miss any group? Anyone? Okay, I'm coming.
Sairam to all. The only thing which we want to add is prefer home food and advise him to spend a quality of time with his family.
Fantastic. Thank you.
Yes.
Anyone else?
Anyone who's not shared and wants to share? Okay, I think we've covered all. So, brother, it's now over to you for your one tip.
One tip. Simple tip for good health: 30 in the morning, 60 in the afternoon, after work, 90 in the night. Hello. 30 minutes without a device in the morning when you wake up. 60 minutes without a device and a phone after you come back home. 90 minutes without a device just before you go to sleep. People are really happy. My God. No device. That's the diet. Thank you. Sister, you're
I have a very simple tip. I have no social media accounts. I don't scroll, I don't check, I don't see, I don't keep up. So I spend walking alone every day if I can, or at least a few times a week. And the only thing I do is I meditate, I contemplate, I reflect, I thank, and I take stock of my life during my 1 hour walk in nature. That's all I do at the same time. Thank you, Sarah.
Thank you so much. Give the mic. So, yesterday she said, I'm modifying the St. Francis Assisi, which I read somewhere. God, give me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the one thing I can change is myself. With this, I would end what we are discussing. Yes, over to Sai Lakshmi.
Thank you. Thank you to both of you, Mr. Vijay and Ms. Sheila. I think thank you for giving everybody an opportunity to speak their thoughts, to share their learnings. And you facilitated this opportunity for all of them to be heard, which is a great opportunity for themselves, and to be heard is the single most, I think it's the first step to what you say is healing and transformation, the ability to be heard. And I think thank you for giving everyone a chance to be involved and engaged in this session. Gratitude to both of you. We will now conclude this session and break for lunch. We will resume the next session at 2 p.m. We have a very interactive hands-on learning experience. So once you come here, please divide yourselves into groups of about 10 so that it can be easier for the moderators and facilitators to help us learn hands-on training on basic life support and so on. Thank you very much.
And before that, one final thing. There are two sets of people who are usually not acknowledged here, who are acknowledged only when things go wrong. The first thing is the sound system people. Please stand up. All of you stand up, please. A big round of applause and thank you to them. The second set of people are the audiovisual people reliving live. I want you all to stand up. Don't hide. Come on, stand up. Stand up, man. A big round of applause to them too. Gratitude to all of you. Yeah. You can break for lunch.